Okay. Good morning. Distinguished delegates, good morning to you all, my dear colleagues. So I would like to warmly welcome you to the second plenary session of our 93rd General Session of the World Assembly of Delegates. Today's program will focus on the activities of the working groups and specialist commissions, including the presentations, discussion, and proposed adoption of several standards and technical texts, We have a full and important agenda ahead of us and would therefore kindly encourage all speakers and delegates to keep interventions concise and focused in order to facilitate the smooth conduct of our work. And right now, it's my pleasure to introduce Dr. William Karesh. And yes, okay. He is the chair of the working group on wildlife, and he will present us the summary of the activities of the working group for 2025. Floor is yours.
Thank you, Madam President. And to our two Deputy Director Generals, thank you for being here. All of you, it's an honor to be with you again, distinguished delegates and guests. It's great to almost see you with the lights here. And I'm just going to jump into the report we have for our working group. There's a lot of material to cover this year. And I'll go through the order, and of course it's in our written report, so I'm just going to give a summary, and there's more material in the written report that I'll be able to cover here today. But as you saw yesterday with our Director General, went through the 8th strategic plan, and I'm going to kind of try to highlight where the working group and our efforts are kind of fitting into that strategic plan. We use it as our guiding principles for all our activities. And so she talked about, if you remember that graphic of the house with the foundational blocks at the bottom, if you can imagine that in your mind. And so we kind of see ourselves really helping on those foundational building blocks under the strategy to support you and to support WOAH in general across the organization. So we talked about collaborating within the organization across commissions. So I'm going to start here with the Standards Commission, the Code Commission, and so our input into those chapters. So much like you are all asked and in some ways required to really give input into the different code chapters as they come through the revisions. We also coordinate with the Commission and the staff at headquarters to kind of give input into that and broaden it. So what we, as a group, end up with is a lot of different viewpoints adding into the code chapters, so when they come to you for approval and review, you can trust that a lot of different people have come with different views and had input into that for your consideration when you vote. So this is kind of our work plan, and we do this on an annual basis. So you kind of captured that again there, and this past year we've also been integrating more with the code and coordinating better also with the Aquatic Commission, and started looking across those two to see where we can bring in some harmony across that, because in the wildlife perspective, it really goes across both realms. We don't really separate it when we're thinking about wildlife. We're trying to integrate those in and then make sure it crosses over the code chapter so there's consistencies. Then externally, if you also remember from the DG's report about this outreach to bring in other partners, there was a section in the strategic plan about partnerships. So with our working group, we are trying to push for that and work for that, and I know you've heard me talk about it for several years. So I'm going to go through basically these 4 groups that we've been engaging more this year. One is a traditional one with IUCN, and they have a wildlife health working group, but really across IUCN as a partner for WOAH. They have a commission on environmental law. They do a lot with social education, stability, engagement. And in this one now, there was a previous about 10 years ago, a very nice big publication done jointly between WOAH and IUCN on wildlife disease risk analysis. So we're working on that, revising it. It's really not being done by the working group, but we want to stay engaged to make sure that those products align with your interests and what WOAH is trying to accomplish there. We've also been collaborating on kind of fact sheets and guidelines and statements about threats to wildlife and threats to animals and people. And so I'll show you a few examples of those in here. with CITES, the Convention on International Trade on Endangered Species. That collaboration through WOAH seems to be getting more and more productive. We've worked with them on improving, easing a mechanism on the movement of diagnostic samples, emergency diagnostic samples on endangered species. So amongst the reference centers, you can get registered. I think I mentioned this to you last year, but there's a simpler process for you to get your labs registered into the CITES system, so it reduces the paperwork necessary on getting those labs and moving samples across country, so you can collaborate directly with each other and with reference labs, kind of to streamline that process, especially for emergency diagnostics. If you're having a mortality event or a die-off, you can contact each other and work a little more closely. And WOAH staff now have been participating in the Conference of the Parties, the COPs there. WDA, I think you voted yesterday. We've been pushing for quite a while for the Wildlife Disease Association. I think we first presented this about 10 years ago, and it got kind of stuck for quite a while. So I'm really pleased to say that this year it's been approved, this memorandum of understanding with the Wildlife Disease Association. It's a tremendous resource for WOAH. 1,400 wildlife disease experts around the world. All of you, I'm sure, have members in your countries. We'd love to be able to help you link with them if you need local experts, but it's a very strong community of expertise that is willing to help WOAH and help all of you deal with some wildlife issues. As you know, there's thousands and thousands of species, and all of them have disease issues and health issues, so it takes a village to really grapple with this problem, and having WDA as a partner is really valuable. The Convention on Migratory Species, we've just released a new document with them and been working with them for quite some time, but as each particular issue comes up and the fact, kind of a fact sheet and some information and recommendations just came out last month. It's a really nice document. These are all available at the kiosks, and this is about non-steroidal anti-inflammatories and the vulture decline. Nothing new, I hope, for most of you that are well aware of this, but even now, 20 years later, we're still seeing problems. And so it's really continuing. They're still being used in veterinary medicine around the world. There's some controls. Some countries have very good controls, some do not. So we've been working with the drugs, the animal medicines working groups also on this, but CMS has presented this to all their member countries, their delegates from the environmental side, about trying to reduce and use alternatives to diclofenac particularly, but there are safe alternatives to use as anti-inflammatories for domestic animals, so we're trying to encourage that and work with veterinary regulatory bodies in countries so it can kind of slowly transition to safer drugs. And that's the front page of the guideline document that was just released on World Wildlife Day. With the Wildlife Health Framework, tomorrow you're going to hear about that along with the 8th strategic plan for WOAH. We have the second kind of plan for the wildlife health, what was called the Wildlife Health Framework or the Wildlife Health Strategy. That is in, I hope you can come to the side event tomorrow where that'll be rolled out. But I just want to assure you that us in the working group have worked really hard with the staff to make sure it's very closely aligned and integrated into the 8th strategic plan. So we want to have the wildlife strategy fit really tightly with the overall WOAH strategy, of course. And then we use that as a working group to guide our annual work plan is based on the strategy and this for WOAH in general and for the working group. So we really want to tie that together. And I mentioned tomorrow, if you can make it, that would really be great to hear more about it. There was a veterinary consultants report. I don't know if it was included in the documents, but there was one about a year or two ago, and then they've recently looked at legislation required to the aquatic world of animal health. So the working group was taking a look at that this year and found that the two reports from the same consultant on regulatory frameworks and legal legislation was very insightful. And I think if you have a free 20 minutes sometime this year, in the next few months, to take a look at those consultant reports and kind of skim through them. We thought they were particularly interesting because they're kind of identifying where wildlife is left out and where it could fit in. And really, particularly for aquatic animals, for most countries, the legislation around aquatic animal health is not very, it's not very precise and not very strong, and it's often just lumped into something as a mention in the fisheries law or something about the environment, but not really good, strong legislation for you in your veterinary departments or veterinary services to underpin your work. So we thought that deserves some attention going forward on that. Collaborating centers, also as a working group, now there's been established. It's just very confusing for me because now we're coordinating the collaborating of networks, and there's a lot of fancy words there. But really what we're trying to do is facilitate or help collaborating centers work more closely with each other. So these networks have been created by WOAH, by you, and it's really impressive what they've been able to do now that they're interacting more. And it really gets into what was talked about on Monday and Tuesday about improving the efficiency and the effectiveness, or yesterday when we were hearing about the budget, and you wonder why, how does this organization do so much with not so much money compared to a lot of other organizations? And a lot of that has to do with you and the working groups and the volunteering on the ad hoc groups and these collaborating centers that you support is really what makes WOAH so cost effective. So we're bringing in thousands of experts, of course, that are really not being paid out of the budget that we're putting money into. So it really builds a highly productive and effective workforce, and if you want to describe it that way, and these kind of networks are really building on that and maximizing that. So they've been working on outbreak response guidelines. Some of the networks have been meeting. I had a beautiful picture that was really there. I don't know what happened. It got lost in this presentation, but if you close your eyes, you can imagine this beautiful picture that Dr. Anna Wong sent from Singapore with the meeting and all these very happy experts meeting together, and it's beautiful Singapore, of course. And you can open your eyes now. It's okay. But it was very nice, and I'm really apologies that she went to all that effort to send it to me, and then it disappeared. And then the wildlife focal points. I think the delegate from Gabon yesterday, the day before, had mentioned training for the focal points there. And I did want to say for the wildlife focal points, the next round of training is commencing later this year, so that'll be 2026 and 27 for that next round. It's been reorganized. It's very impressive what they've done, also with the help of some external consultants to shorten the cycles and get them more focused and do a quicker review of the effectiveness and target it before the next cycle. And also the e-learning modules take more advantage of what's already been produced. I know a lot of you are appointing new focal points, so they have to catch up, and when they come to the focal point workshops, we have very experienced focal points and then brand new focal points, so we can try and use those e-learning modules to bring the new people kind of up to speed so they don't have to spend so much time in the workshops catching them up to the more experienced group. Lead ammunition has been a push. We were trying to, the last few years, work with some external groups on pursuing this, and that has not turned out to be so effective or productive. So WOAH, we have decided to go it alone on this one and just charge forward. And encourage all of you and governments around the world to really think hard about lead used in ammunition for hunting and decreasing that use. I know some of your countries have already banned the use of lead hunting, and especially for waterfowl and wetlands, but we're really talking about thousands and millions of metric tons of lead being shot into the air for hunting and ammunition, and it falls in the ground, and it ends up in wetlands, it ends up in the soil. There's good evidence now it gets absorbed by crops. So some really nice work's been done in Argentina and looking at how it infiltrates into food crops and then we eat it, or it gets into, or animals eat it and it's very toxic. So really pushing ahead, and we should have a statement for you. Hopefully in the next month or so, it should come out. We've been working hard on this for the last 6 or 7 months to really push forward. And there is that conventional migratory species they have actually already signed. So most of your countries have signed that agreement for the CMS. But we really thought that veterinary services and animal health could play a big role in explaining why this is really important. And then kind of in the breaking news section here, I just wanted to highlight rabies, and I think this gets back to what I was starting in the beginning about some of the code chapters, and we're thinking a little more broadly as that work progresses in the future and integration. And the fact that I mentioned the consultant said, well, what about marine mammals? We're going to say, well, where do marine mammals fall? Well, technically in the terrestrial code because they're mammals. But it's kind of, they live at sea, most of the world, so we don't think about them much. And I think it's important for us to kind of think about what's going on there. You know, they're keystone, important species around the world. They're harvested, they're big on tourism, they serve a big ecosystem service. And we want to make sure we're not missing, forgetting about something that plays a role on this planet. I think this highlights it because we've had this outbreak in the South Africans. It's just amazing that they picked this up and detected it and traced it back to a blackback jackal rabies type. The jackals will come down on the beach, but they're the same beaches the people are going on. So you have your local people going to the beach, and then the sea lions are on the beach. It used to be kind of a fun event, but now what we have is rabid seals. And of course, they live in colonies, so they bite each other all the time, so it's spreading through. It's a pretty thing. They've had now 135 people have been bitten by fur seals, which is unheard of. They usually run away. If you've ever been around seals, they don't really chase you around until they have rabies. And then they get neurologic and they just act like a rabid dog. It's just kind of the same thing. They are carnivores. It's no surprise. What's surprising is no one's ever really seen this before, and the South Africans figured it out. It's just, I'm just so impressed with what you've done. I don't know where you are out there, but thank you for doing that. And there's already one suspected case of it getting back into dogs. So you have these animals that normally, they're aggressive with each other. That's why the disease spreads so well among them. But they're not normally aggressive to people. Or to other animals until they get rabies, like I said. Some people are already out there and testing injectable vaccines to see what they can do. Some of these are vulnerable type species. Like I said, they live in huge colonies. So now we've already had the first case. The population in southern Africa goes up the coast in Namibia. And I think the Namibian population, if you're here, correct me if I'm wrong, but I think it's like 1.2 or 1.4 million seals in these colonies on the coast of Namibia. They do a harvest every year. It's a huge economic revenue source. And you get rabies in there, and you have people trying to harvest these animals for economic reasons, and they're going to be exposed to rabies, really a complicating factor there. And other subantarctic species come up and also haul out on the same beaches with the fur seals. So you have this opportunity for them now to get infected with rabies and move it to other areas. It's already, you've got the southern elephant seal, which has just been listed now as threatened and endangered. It's moved up because of other contributing factors, including HPAI. But remember, these animals travel around the globe. So last year, I think I showed you the picture of HPAI moving circularly around the southern seas, and now we've seen that with HPAI. It has moved through the islands across the southern we have the same dynamics at work with potentially for rabies and these marine mammals and sea lions. So they can go contact with the animals in southern Africa, and they'll move down to the island. So we don't know. Hopefully, we don't know things like how long they incubate the disease. If it's really 6 months, they could move very far. If it's not, if it's a short incubation, then maybe it's self-limiting there. But there's a lot to be learned, and we just wanted to give you a heads up on that. If you are investigating, one of the confusing things is a rabid seal looks a lot like a seal with HPAI or anything else that's causing neurological signs. So as your teams are investigating die-offs, you're going to really have to now include rabies in that rule out. So we know about red tides or harmful algal blooms. Those are neurotoxins. That's going to be very easy to confuse with the seal with rabies. So it really brings up our vigilance, the demand for better vigilance on safety for our field staff and for other workers, biologists, other people, and veterinarians in your community. If you're thinking about, like, they need to be alerted if you think you have dog rabies under control, but those are exposed to potentially wild rabid animals like seals in that southern Africa. Potentially, you could be exposing veterinarians in private practice that would not be thinking about rabies actually being an issue for them. And then South Africa did it again. They found HPAI in a Cape fur seal. That's the first report in that species with HPAI. So once again, confusing those diagnostics between rabies and HPAI, and it's kind of a scary situation, but everybody needs to be aware of it. And then once again, we're going to come out with some guidelines very soon. On the avian influenza front, I think everybody's kind of aware, but this is some interesting work that just was released about the annual cycles, and this past winter up here was really a pretty dramatic view, and you saw Dr. Hutchinson, Jenny Hutchinson, yesterday with the information department, or the day before, present that data and was showing the map of HPAI, and particularly the cases in Europe. And this is just a different way that came out. I think this is from EFSA, or published in EFSA. And you see that huge spike this year, not that we really understand why, but this is kind of the mix with influenza in wild birds just in Europe. And those are the annual cycles in our kind of our winter time, fall and winter, spring. And then you see that big peak this year. Obviously, I don't need to point to it. You all can see it. And that just kind of shows a different kind of view. That's poultry in the light blue color, and wild birds in the purple or violet. And you see this kind of overlapping spikes there in Europe, and those are over the last, I think that's 5 years. So you see kind of that cycle through the years there, but a big one this year. It just keeps expanding its host range, so we're getting into more species of birds, more species of mammals. So we heard a little about that from the information department, but now we're talking about avian influenza in over 500 different species of wild birds. Pretty incredible. I don't think anybody's anticipating this 10 years ago or 20 years ago. And 120 species of mammals. It's pretty, and I know I've mentioned it to you in years past, and I'm just going to say it again. I'm just really uncomfortable even calling influenza A this type avian influenza. At this point, it's not, I don't know how it's helping us get the message across. There might be some pragmatic reasons for doing it, but in general, in our messaging and talking about this, you know, this is influenza A, and when you've got 120 mammal species with it, it's hard to still want to call it avian influenza, but it's influenza A. So also something to be kind of thinking about. We've got 1.4 million birds mortality, and it's a pretty dramatic number there. I mentioned the guidelines, and this is really about HPAI. So this year we decided we need to it's a growing issue around the world, so it's time to update these. We did them about 4 years ago. So they're all going to be updated on these guidelines related to working with avian influenza and considerations for emergency vaccination. So this year you'll see those coming out as they go through the pipeline. And then for kind of my breaking news event, I just wanted to cover the potential for El Nino this year. There's talk about a really dramatic version of the southern, it's an oscillation event between El Nino and La Nina. It has a global effect. It's talking, I don't know how they got a satellite image from 1877. That really confuses me. But this was in a newspaper, so I'm saying it's proof. Anyway, what I do trust is kind of the projections for this year. It's very early. I mean, it's unusual in May to start getting a read for next November, so October, November, December. So the systems are getting better on using remote sensing and predicting, but ocean temperatures are really changed. That's the Pacific Ocean, if you haven't kind of clued in on that yet. But this turns into very predictable aftermath, and I've showed you this before, and what you end up with is this kind of the surge of warm water that comes across the Pacific. It moves east, and so, of course, you in South America, you in Peru and Chile and Ecuador, you're very familiar with the effects of El Nino, and you'll have the upwelling from the ocean slows down because the warm water's sitting it. So you have a collapse of your fisheries, so you have to change all your harvest models or your quotas for harvesting. But it has a huge effect on marine mammals and seabirds. They all start dying. You'll confuse that with HPAI now. So it's really going to actually complicate issues on there. So you'll have massive die-offs of seabirds and sea mammals. And then massive rainfall on land, so you'll have flooding in that part of South America. We get increased rainfall in North America, so you have mosquito-borne diseases, but we also get selenium, copper deficiencies, extra rainfall, more grass. The grass doesn't have the same nutrients, but the cows eat it and they get full, so you have to supplement with copper and selenium. Or you lose your calves, have a poor calf crop. So there's all these implications around the world. Southern Africa will see drier weather, maybe droughts. East Africa, rainfall, disease outbreaks, and even over, once again, all the way around to Southeast Asia. You all know that live and work there about fires and smoke damage. In humans, they see a big spike in respiratory diseases or respiratory health problems because of smoke and fire. The air is hotter, drier. So that's coming your way. Look forward to that September, October. Be prepared. Think a little about it. Assign some of your people to start thinking about it. The warnings are there, and we'll see how it rolls out. Maybe it's not going to be as bad as people say, are thinking it will be. The big news, other big news, and tomorrow, launching this week, is the Wild Epi. So we heard about that from the Information Department report. This is another way to enter information on wildlife diseases by you. You, as a delegate, can assign people the authorization to enter data. This is for non-listed diseases, non-reportable diseases, so it shouldn't have any effect on trade. It's a very different system, but very easy to use, and it can be used on a phone or a laptop or a tablet. So easier to enter the data. It's very user-friendly, and once again, non-official information, but it will allow you, so if you work with the wildlife department or some NGOs that are doing wildlife work, you can actually give them access under your authorization. You can allow them to enter data, so we can be sharing data. It's unofficial data, so it won't, again, should not affect trade. But it's going to be of higher quality because you have some knowledge about who's doing it and get to say who's doing it. There's certainly more control than over a newspaper or media event or a social media influencer. So it's a really nice and kind of alternative to getting information out and sharing it, and it's available for you, so that's rolling out now. And then finally, I did actually have two more breaking news. We're hearing about the Ebola outbreaks. That was a little too new to be putting in here, and hantavirus on a cruise ship. There you go, another cruise ship with carrying around something. They're not in my report, but if you have questions about that, we can talk about it. I wanted to thank my group. Couldn't do it without them. We have a great group from around the world, so thank all of you for supporting them and allowing them to engage in the working group. And I know that they all work closely with many of you in the countries where they live. We do have a new member from Kenya joining this year, Francis Kikai, who's a brilliant wildlife expert. He's been doing this for decades and decades. So we're really pleased that he can join our group, and thank you, Kenya, for being supportive of that. And that's it for the report. And I have 2 seconds, 1 second, I'm finished. Thank you.
Thank you very much, Dr. Karesh, for this very comprehensive presentation, and I'm glad to open the floor to hear your comments or any questions that you may have. I start by Australia. Floor is yours.
Thank you, Madam Chair, and Dr. Karesh for the excellent presentation on the diverse and extensive work of the Wildlife Working Group. Australia congratulates WOAH on the successful implementation of the Wildlife Health Framework, which has enhanced the understanding and importance of wildlife health at a critical time for global animal health, One Health and pandemic prevention. We welcome the next phase underpinned by the Wildlife Health Strategy and look forward to supporting its outcomes. We emphasise the ongoing importance of embedding wildlife health into surveillance, preparedness, risk analysis and responses as being essential to preventing disease emergence, protecting wildlife biodiversity and safeguarding global animal health.
Thank you, Australia. I have a request from Senegal. Yes, you have the floor here in front. Thank you.
Thank you, Mrs. Chair. So it's on my turn. I would like to congratulate Dr. Karesh for the excellent presentation. And I would also like to congratulate WOAH for the implementation of a new strategy on wildlife. This is part of the advocacy for the One Health approach. But also, I would like to congratulate for the update of the veterinary legislation on wildlife, because it is crucial. It's sort of backward in most of our countries. So to conclude, I would like to encourage WOAH to pursue the training of the focal points so that we can improve the reporting process. Thank you very much.
Thank you very much. Any other comments? Paraguay, please, you have the floor. Here in front, here.
Muchas gracias, Presidente.
Well, thank you very much, Mrs. Chair. I would like to congratulate Dr. Karesh and the working group. This is an excellent presentation with a lot of information, but still I have one question on the experience on HPAI. You know, you were talking about the future of the world pandemic. You were saying that the future was influenza. So how do you perceive this assumption that apparently that we have 2 years? If influenza was the next pandemic, I would like to know your opinion based on your experience about it.
To answer, Dr. Karesh.
Okay, thank you very much. Australia, thank you for the great comments. And I guess this won't be a secret anymore because I'm going to tell all of you. But thank you, Australia. I think our working group benefits also tremendously, and we often model a lot of our recommendations and things that you've already done in Australia, and it's been incredibly useful. So I think I hope you're proud of what your team and what you're doing in Australia has done, really, for helping to break the ice and kind of lead the way. And I think all of you, I'm hoping you're finding some of these products useful, and some of them are really, many have been adapted and the input from Australia. So thank you so much for what you've done. Senegal, thank you, Dr. Lowe. I think the legislation work is fascinating. I'm not a lawyer, but every time I'm reading about these things, I'm just really intrigued about how important they are and what it is, and what, how all of us can help to influence that, because it makes our lives easier, but it makes our countries hopefully safer. I am a law and order stuff, so I won't get into the politics in my country right now. But it is important, and we want to kind of move into that way. And the focal point training, I appreciate you mentioning that. I think the team at WOAH puts a lot of effort and a lot of thought, and that's really also the collaborating centers really contribute tremendous amounts and volunteer a lot of effort into that focal point training. So we hope it's useful, but I think the more input all of you have into some of what's needed in those training programs and what you think is important, the more targeted and more focused that can be. So don't be shy, don't hesitate if you have suggestions and comments in that for focal point training. And the next big flu pandemic. I am with you. I'm just in the feeling that, of course, there's a cycle, and we've been seeing this for 100 years at least, that we understood, and the influenzas change and they move around, and we'll have another pandemic. I'm kind of a pro-vaccine person, so I'm a little biased thinking, not that I know how to make a vaccine, I've never made one, I'm not a virologist, but I still am very supportive of the idea of vaccinations. So I think some of those would be helpful, and all of you that work in that field, the more family level, influenza family level vaccines we can create, or a pan-influenza vaccine, I think that could help. And then, of course, public engagement and really education of the public there. I was going to mention that today we have time. I do. I'm going to take my 3 minutes to mention I saw on the news today that the rocket company SpaceX is going public with their stocks. So that's big news. And the person behind that is, has a vision of moving humans and human colonization to Mars or to Moon, and we're all go live on Mars in the future. And this dream of maybe creating a new world with no disease, and everything will be sterile, and there'll be no animals and no meat, and maybe a house plant. And it's not a vision of the world that I'm very excited about. And I hope that what I see embedded in there is like a hopelessness that we can't fix all the damage that we have done on this planet, so we're just going to move. And it's just like, great, but the 8 billion of us that have to stay here, maybe we need to be working on controlling some of that damage so that the Earth continues to be a wonderful, delightful place to live for our children and grandchildren in the future. So I'm kind of a anti-SpaceX. I'm not really anti. I'm sure I'll buy the stock. But in the meantime, I'm not really following that thought. And I think we have a lot of work. So the influenza pandemics and those things that are getting together to try and solve these problems. And so, so the doomsayers don't say there's no hope for humanity. There is hope for humanity, and us in this room working together is proof of that. So thank you.
Dr. Baba, please.
Thank you. Madam Presenter. Do I have sound? Yeah.
Yeah.
No, just to before we let Billy go, to join us all to sincerely commend your scientific leadership, Billy. You and your team.
Oh,
You've been doing amazing things.
Oh, thank you
So
very
thank you
much.
for really driving this work at a time when it matters most, I believe. What happened recently has helped us all. It has been an eye-opener on the critical importance of wildlife health and how it connects to the all other important part of our safety. And I share your desire to still stay on Earth. Let us stay on Earth, and let us try to save our planet.
Yes.
And we can do it. Thank you very much.
Thank you.
So please.
Thank you so much, Dr. Koresh. Also extend my comment and my grateful to you, the entire team. And it was a very positive message that you let us, a little provocative, but we need also those comments to move ahead. And it was a message, a very positive one that you leave us today. And I wish you the best for you and for the working group. Thank you so much. Now I have the pleasure to invite Dr. Arshni Mudley, Chair of the Antimicrobial Resistance Working Group, to present the summary of the activities of this working group. Thank you so much. The floor is yours.
Good morning, delegates, colleagues, and friends. It's a real honor to speak to you today as the chair of WOAH's Antimicrobial Resistance Working Group. AMR is often described as a silent pandemic, but for many of us, it is not silent. You see it when treatment fails. You see it when farmers lose animals. So let me begin with a simple point. Antimicrobials are an essential part of our animal health toolbox. And our AMR agenda is not about removing antimicrobials from animal health. Instead, it's about protecting their effectiveness and making sure that when animals need treatment, effective antimicrobials are still available, accessible, quality assured, and used responsibly. And so yes, AMR is important. The AMR, let's get started.
Do you need some help?
I'm just trying to get the slide to move. So the AMR Working Group was created by WOAH's Director General in 2019 and supports implementation of WOAH's strategy on AMR and prudent use of antimicrobials, as well as the recommendations from the second WOAH Global Conference on AMR. The working group has three core functions. The first, we support WOAH specialist commissions in the development and maintenance of international standards. Second, we provide technical recommendations and feedback on WOAH's AMR work, and this helps to ensure that tools, lists, guidance, and initiatives are scientifically sound and also useful for countries with very different animal health systems and capacities. And third, we help inform WOAH members of wider AMR activities, including global commitments, data systems, emerging tools, and opportunities for engagement. So in short, the working group helps connect global AMR ambitions with members' realities. So let me start with the first core function of the working group, supporting WOAH's specialist commissions. The AMR Working Group is currently supporting the update of two chapters. The first is Chapter 6.2 of the Aquatic Code on Responsible Antimicrobial Use. The second is Chapter 6.8 of the Terrestrial Code on Harmonization of AMR Surveillance Systems. In both cases, the working group is not only providing comments to the draft chapters, but are also active members in the relevant ad hoc groups. For the Aquatic Code, Chapter 6.2, the draft chapter has been circulated to for members' comments. I strongly encourage members to review it and provide comments, particularly if aquatic animal production is important in your national context. Aquaculture is one of the fastest growing food production sectors globally. It is also a sector where antimicrobial access, veterinary oversight, disease prevention, diagnostics, and biosecurity can vary enormously. The deadline for comments is 3rd of July, and these comments will be reviewed by the Aquatic Animal Health Standards Commission in September. For the Terrestrial Code, 6.8, both Dr. Carolee Carson and myself are participating in the ad hoc group. We have already had several meetings, and we aim to finalize the revised chapter by the end of June. The working group will then review this draft before it is submitted to the Terrestrial Animal Health Standards Commission in September. Surveillance is one of the words we use so often that it can start to sound routine. But for AMR, surveillance is power. It gives country the evidence to understand trends, identify risks, justify policy decisions, and evaluate interventions. Without surveillance, we are not managing AMR, we're guessing. Let me move to the second core function of the working group, providing recommendations and technical feedback to WOAH. Since the last general session, the working group has provided advice on 4 main areas. The first, the global survey on WOAH's list of antimicrobial agents of veterinary importance and its technical reference documents. The second, the development of a future vet aware and the framing of the third WOAH Global Conference on AMR. Third, the work on substandard and falsified veterinary products. And fourth, an article on alternatives to antimicrobials. They may seem like separate activities, but they're connected by one question. How do we move from our AMR commitments to practical action? So in June 2025, WOAH launched a global survey on the WOAH list of antimicrobial agents of veterinary importance and the associated technical reference documents. The survey had 2 main purposes. First, how visible and useful these tools are to members and stakeholders, and second, to gather feedback on the proposed new categorization criteria for the WOAH list. And the response was encouraging. Awareness of the list was high and at 81%, and more than 85% of respondents found the list useful. And this tells us the list is recognized and valued. But the survey also showed that the awareness of the technical reference documents was much less. And that matters, because a tool that is technically excellent, but if members don't know it exists or don't know how to use it, then it has limited use and impact. The working group reviewed the survey findings and provided several recommendations. We support piloting the proposed new categorization criteria before wider use, and we recommended separating the responses from members and other stakeholders for transparency. We also recommend creating more technical reference documents for different species, because the TRDs are important as they translate the WOAH list into species-specific practical information. We raised similar concerns as some respondents about the inclusion of productivity in the proposed categorization criteria, and we recommended removing reference to productivity because it does not directly relate to animal health and could create confusion around the use of antimicrobial growth promoters. And we'll revisit these points in our October meeting. The working group has also been providing guidance on the development of a future vet-aware list. This responds to Commitment 7 from the 4th High-Level Ministerial Conference on AMR in 2024. And you can ask yourself, why do we need a vet-aware? We need it because animal health are constantly asked to balance 2 things that pull in different directions. On one hand, we must protect access to antimicrobials that are essential for treating animals, and on the other hand, we must reduce unnecessary, inappropriate, or high-risk use. And that balance is not easy. For members, the value of vet-aware will be practical. It will help countries think through which antimicrobials should remain accessible for common animal health needs, which require closer monitoring, and which should be reserved or restricted. It can support treatment guidelines, procurement, veterinary education, and stewardship conversations with farmers, the industry, and policymakers. The working group has reviewed the suggested methodologies and recommended that a single ad hoc group be formed to develop a single list across animal species. We have also drafted the terms of reference for that ad hoc group. Alongside this, the working group also brainstormed with the WOAH team on possible focus areas for a third WOAH Global Conference on AMR. Our view is that the conference should focus on what matters most for implementation: data and evidence, funding and sustainability, policy and governance, behavioral change and stewardship, innovation and collaboration. At this stage, in the global AMR response, we don't need more commitments. We need support to deliver on the commitments we already made. Concept notes have been developed for both WOAH and the third Global AMR Conference, and implementation of both now depends on securing the necessary financial support. Other areas where WOAH's work is highly relevant to members is substandard and falsified veterinary products. It is often discussed as a regulatory or pharmaceutical quality issue, and it is that, but it's also an AMR issue. If a veterinary product does not contain the right active ingredient, contains too little active ingredient, is poorly manufactured, degraded, falsely labeled, or illegally distributed, then treatment fails. Farmers lose trust, animals remain sick, and antimicrobials may be misused or repeatedly used, and the risk of resistance increases. This is a very real problem, but it's also a difficult one to detect, document, and respond to. WOAH has been strengthening work in this area, including the launch of TruVet, WOAH's global alerts system of substandard and falsified veterinary products. TruVet was launched this Monday, and on the 3rd of June, there will be a webinar for members, private sector, collaborating sectors, and partners to introduce the platform and explain how the system works. So I encourage members to visit the TruVet team at the AMR Corner, join the upcoming webinar, and sign up to TruVet. The working group also provided feedback on an article on alternatives to antimicrobials. This responds to recommendation 8 from the second WOAH Global Conference on AMR. The article is being developed by experts from APHA, WOAH's reference laboratory on AMR, ANSES, WOAH's Collaborating Center for Veterinary Products, and WOAH, and is expected to be released in 2027. It's important to note that this is not being developed as a guidance document. It is intended to take stock of the current global situation and stimulate discussion amongst members. And that discussion is important because when we talk about reducing antimicrobial use, the obvious question is, reduce use, but replace with what? So the article matters because it helps open more realistic conversation. Not antimicrobials versus alternatives, but how prevention, diagnostics, vaccination, biosecurity, animal husbandry, animal welfare, and all the other tools we have can reduce the need for antimicrobials in the first place. Now let me turn to the wider AMR landscape. This is where the working group's third function comes in, helping inform members of wider AMR activities and global developments. In 2016, the United Nations Political Declaration on AMR was historic because it put AMR on the agenda for heads of states and governments. It recognized that AMR could not be solved by the human health sector alone, and it helped establish AMR as a One Health challenge. But for animal health, the 2016 declaration was still largely a call for action. But in 2024, the declaration is different. It is much more specific about what the animal health sector must deliver. It recognizes that veterinary services are not peripheral to the AMR response. They are central to it, and for the first time, we see clearer commitments relevant to our sector. These include reducing quantities of antimicrobials used in animals, promoting prudent and responsible use, prioritizing prevention with a focus on vaccination strategies, and investing in essential veterinary services. For members, the message is simple. The animal health sector is now clearly visible in the global AMR commitments. And that is a good thing. But visibility also brings expectations. Members will increasingly need to show how they are monitoring antimicrobial use, supporting responsible use, investing in prevention, and how veterinary services are contributing to national AMR action plans. And this is where WOAH's tools and standards are so important and helpful. Linked to the UNGA commitments are reducing antimicrobial use and ensuring prudent and responsible use in animals. One of WOAH's most important tools is Animuse, the global database on antimicrobial use in animals. Since 2015, members have been reporting data on quantities of antimicrobial agents intended for use in animals. And this is significant because it allows the animal health sector to speak with evidence, monitor trends, and show its contribution to the global AMR response. Animuse reporting is now changing to increase visibility and impact. As of this year, the preliminary AMU findings will be included in the State of the World's Animal Health Report. And then from November 2026, the full Animuse report will be released annually during World Antimicrobial Awareness Week. And this is an important shift. It increases the visibility of animal health AMU data, and it reinforces Commitment 69 of the 2024 UNGA Political Declaration. But for members, the real value of Animuse is not only global reporting. The real value is national use. Animuse helps members monitor national trends, identifies gaps, supports policy dialogues, and communicates, assess whether interventions are working, and communicate progress to other sectors. The latest round of Animuse data gives us an important snapshot of where we are. In the 11th round, which closed March 2026, 148 participants reported to Animuse. And of these, 89% reported quantitative AMU data for 2024. And that is real progress. And we want to sincerely thank all members who have shared their data. But we also need to be honest. The number of participants is declining over the years, and that concerns us. Because if we want a truly global picture of antimicrobial use in animals, we need broad participation. Every member's data matters. But there is good news. The quality of the data being submitted is improving. More members are providing quantitative data, and that makes Animuse far more useful, not only for global analysis, but for national decision-making. To those already reporting, please continue. Your contribution matters. For those not yet reporting or have stopped, we strongly encourage you to begin again. And for those who have chosen to make their data public, thank you. That transparency builds trust, and it supports regional and global learning, and it shows that the animal health sector is serious about action and accountability, and it also aligns with WOAH standards. We are also encouraged to see members using Animuse data to develop national reports, and that's exactly what we want to see. Data moving from global reporting into national policy, national planning, and national action. And here, we would like to give a special recognition to Nigeria, Ghana, and Sri Lanka for leading the way among the members trained to develop and release national reports on antimicrobial use. This is the direction we need to travel. The latest Animuse data gives us a reason to pause and reflect. They show us where progress is being made, but also where challenges remain. Antimicrobial use in aquaculture, regional disparities, and some participants still reporting the use of antimicrobials as growth promoters, including, in some cases, highest priority critically important antimicrobials for humans. This is not to name and shame, but it is rather to see where support is needed, be it technical support, regulatory strengthening, prevention investments, and/or political attention. So again, we implore members to please continue reporting to Animuse, and if you're not yet reporting, please begin. And where possible, make your data public. And importantly, use your data. And to all members on this journey, the Animuse team is here to support you. Another major area of work is the prioritization of animal diseases for which vaccine could reduce the use of antimicrobials. Why does this matter? Because vaccination is one of the most concrete ways to shift the AMR conversation from blame to solutions. If we want less antimicrobial use, we need less disease, and vaccines are part of that answer. This work follows Resolution 29 from last year's General Session, requesting WOAH to update its list of priority animal diseases for which vaccines could significantly reduce antimicrobial use. It also responds directly to Commitment 72 in the UNGA Political Declaration. The working group provided feedback on the terms of reference and the planned activities for the new ad hoc group leading this work. The update will take a phased approach, beginning with poultry, pigs, and fish, sectors that are fast-growing and highly relevant to antimicrobial use globally. The process has already updated the disease lists, defined the ranking methodology, and identified priority diseases for further work. The priority diseases include Amaria species and Escherichia coli in poultry, porcine reproductive and respiratory syndrome virus and Escherichia coli in pigs, and key bacterial pathogens in aquaculture, Aeromonas hydrophilia, Enterococcus inea, and Enterococcus agalactia. The QR code on the slide takes you to more information on this work, and I encourage you to scan it, particularly if these sectors are important in your national context. Another UNGA-related commitment is investment in essential veterinary service. And this links directly to the technical item discussed at this year's General Session, investing in animal health to secure everyone's future. And the message from that technical item is clear. Animal health is not a cost center, it's an investment. And that matters for AMR because antimicrobial stewardship is not free. If we ask countries to reduce antimicrobial use, we must also invest in the systems that make safe reduction possible. And we cannot regulate our way out of AMR if basic services are not there. Awareness matters, guidelines matter, standards matter, but without a well-oiled veterinary service, AMR action remains fragile. And this is why the WOAH OECD Forum, Acting Now, Investing Smart, partnered together to tackle AMR in March 2026 was important. It linked AMR to broader global priorities, economic stability, climate change, pandemic preparedness, and global security. And that framing matters because AMR is not only a microbiology problem, it's a governance problem, investment problem, and a systems problem. The QR code links to WOAH's call for investment on AMR, and I encourage you to scan it, use it, and share it, especially with those who make financing decisions. The call sets out WOAH's 5-year AMR vision for 2026 to 2030, built around 4 priority pillars: prevention, resource surveillance, sustainable financing, and cross-sectorial collaboration. These are the building blocks we need to deliver on the 2024 UNGA Political Declaration and implement the updated Global Action Plan on AMR for 2026 to 2036. Finally, I want to highlight 2 important global processes. The first is the establishment of the Independent Panel for Evidence for Action Against AMR, or IPEA, and the quadripartite organizations are working closely together to finalize the document for the upcoming launch of the panel, which is expected later this year. We would like to thank members who provided comments during last year's consultations and who expressed support for the creation of the panel. Before the launch, the documents will be released and information sessions will be organized for UN members and stakeholders. IPEA is important because AMR decision-making needs a strong evidence base, not only on the scale of the problem, but also on what works, what is cost-effective, and what can be realistically implemented in the different contexts. And this matters deeply for the animal health sector, because the evidence guiding AMR action cannot come from hospitals, human health laboratories, or clinical settings. It must also reflect animals, food systems, and the environment. The second process is the updated Global Action Plan on Antimicrobial Resistance for 2026 to 2036. The update of the global strategy on AMR has now been completed and will be presented to you for adoption after my presentation under Resolution 18. Simultaneously today in Geneva, the World Health Assembly, the updated GAP is being put forward for adoption for WHO member states. And later this year, FAO will put forward the GAP through its governing processes, and UNEP is expected to do the same in 2026. It is important because it shows that the updated GAP is not the agenda of one organization or one sector. It is a shared One Health agenda. And we would like to thank all the members who contributed comments and input during the consultation process. Your engagement helped ensure that the animal health sector is adequately represented across the strategic objectives of the updated GAP. This 10-year strategy will help members ensure that the national action plans on AMR includes all sectors and in a meaningful way following a One Health approach. But adoption is only the beginning. The quadripartite has already started working on operational guidance to support members in implementing the updated GAP. It is also developing a monitoring and evaluation framework so members can assess progress in implementing their national action plans, and we'll keep you updated on these processes. So let me bring this back to you. WOAH's AMR work helps ensure that the animal sector remains visible, credible, and influential in the global One Health AMR governance. And if we don't define the role of animal health in AMR, others will do it for us. And they may not fully understand the complexities of our animal health systems. And that's why your engagement matters. So please engage with the standards process. Use the WOAH tools and platforms. Lastly, I would like to encourage you to scan the QR code for the latest WOAH scientific and technical review issue on AMR and visit the publication booth outside. I had the privilege of co-editing this issue with Jean-Yves Madec, and it's the first comprehensive review on issues related to AMR in the animal health sector since 2012. It brings together the latest science, policy and practice across AMR understanding, monitoring, surveillance interventions, sector-specific challenges, cross-cutting themes such as governance, economics, and tools to help countries assess and prioritize AMR interventions from a One Health perspective. Please read it, share it, use it. Finally, I want to sincerely thank the members of the AMR Working Group, past and present, our amazing secretariat, and the WOAH colleagues that we work with who continue to support, for their continued support and commitment. And I encourage all of you to visit us at the AMR Corner for more information. Thank you very much.
Thank you, Dr. Moodley, for your excellent presentation. I open the floor for our delegates. Any comments? Questions? Australia, please.
Thank you, Dr. Moodley, for a very clear and interesting presentation. There's clearly a lot of work going on in the AMR working group. Today I speak on behalf of the Animal Health Quadrilateral Alliance, comprising Australia, Canada, New Zealand, the United Kingdom and the United States. The Quads Alliance would like to commend WOAH and the Quadripartite Joint Secretariat on AMR for their considerable effort in updating the Global Action Plan on AMR and for providing members with consultation opportunities throughout the process. Antimicrobial resistance is one of the greatest threats in modern medicine. As antimicrobial use is a driver of AMR, these essential medicines must be used prudently in all sectors. A global threat such as AMR, which is inherently complex, cross-cutting and interdependent, requires a unified and transparent One Health approach. Only through working together and learning from our failures and successes can we make any advancement in reducing antimicrobial resistance and ensuring the effectiveness of our current antimicrobial medicines. The Quads Alliance appreciates the efforts of the quadripartite to incorporate a One Health approach within their AMR Global Action Plan. The Quads Alliance looks forward to the adoption of the updated Global Action Plan on AMR and recognises WOAH's efforts to support members to address AMR globally. We would like to emphasise that achievements to date must be sustained over time and further strengthened. Our efforts to combat AMR, to support overall readiness and response capacity and animal health and welfare worldwide. Thank you.
Thank you, Australia. Nigeria, you have the floor.
Thank you, Madam President and the Director General, with all members of the High Table. Mine is actually to thank the Chair of the Antimicrobial Working Group for recognizing the modest effort put by Nigeria into the work of AMR. I want to place it on record that we're actually very grateful to the Fleming Fund. Apart from the guidelines that WOAH provided to Nigeria, they supported the work of AMR in all, not all, but in selected sentinel sites, laboratories, and aquaculture. And I want to also place it on record that this work was actually facilitated and made easy for the Chief Veterinary Officer of Nigeria by my very humble and indefatigable Honorable Minister, who is here seated with me again. He provided all the support we needed. And honestly, beyond the issue of AMR surveillance, for the first time in the history of this country, of our country, that we have an essential veterinary medicine list. For me, this is a mean achievement. It's not a mean achievement, it's a great achievement for us. And like I said, I don't want to take too much of your time, but to really thank you for also recognizing the effort that the country is going to put. We can only get stronger. And I can tell you, all the documents we have produced on AMR has been endorsed by the minister. They have become working documents of the Federal Republic of Nigeria. So on this note, thank you very much, colleagues, once again for recognizing the little effort they are making in stemming the tide of AMR in Nigeria. Thank you very much.
I don't see any other comments. Okay. Yeah. Yeah, no, please. Okay. You want to add anything to the comments that our colleagues made, Dr. Moodley?
Thank you very much to Australia and Nigeria for their very positive feedback, and as well as the support of the for the adoption of the Global Action Plan. And we do thank and recognize Nigeria, even if it is a modest effort, as you put out. I think all efforts count in this long life battle for AMR. So I should introduce?
No, I will. Thank you so much. So I can say to our delegates, our assembly, that we have quorum on the room, so we will now proceed with the consideration of resolution number 18 on the Global Action Plan on the Antimicrobial Resistance 2026-2036. So the draft resolution has already been presented. So are there any objections to the adoption of this resolution from the Assembly? I can't see none. And are there any rejections? Abstentions? Okay, so it's approved by consensus. Thank you. Thank you very much, Dr. Moodley. And now we will proceed with the activities of specialist commissions. And I will give the floor to you, Monse.
Thank you. Thank you, Susanna.
It's not working?
Yeah, now it's working. Thank you, Susanna. Just before we begin with the work of the specialist commissions, I would really like to just remind you of the efforts that our specialist commissions and the Secretariat has been doing to improve the standard setting process. And as such, I made a specific visit to every single regional commission to remind you that we will be making this call for experts to join the WOAH specialist commissions. The call will open on the 6th of July and it will close on the 11th of September. So please encourage your experts to apply online on the website starting on 6th of July. And there will, well, the guidance it's on the website, so you can consult it. And if you have any questions, please don't hesitate to contact the Secretariat. Before we begin, and I invite Dr. Etienne Bonbon to come to the floor, just a very brief reminder, please, we are having I would say, an excellent general session. And to ensure that this is still the case, please, I invite you all to adhere to the code of conduct that it's written in your badges, and it's a commitment that we all need to make, and to really be clear that we all behave according to the professionals that we are. So thank you so much, and with that, I hand the floor to Susanna. Thank you.
Thank you, Monse, and thank you for highlighting important information. So now I have the pleasure to invite Dr. Etienne Bonbon, President of the Terrestrial Animal Health Standards Commission, to present the standards proposed for adoption. Give you the floor.
Merci. Merci, Madame la Présidente.
Thank you, Madam Chairperson. Madam Chairperson, Madam General Director, dear and Deputy General Director, dear colleagues. I would like to start my report in French, and I will try to finish my presentation before the break, before the coffee break. And speaking French is going to help me deliver this presentation in a faster way. I'm a bit talkative, and my English is not quite as fluent as my French, so I might be able to say more things in French. Short introduction. This is the introduction. I will start without further ado, and then I will go over the documents proposed for adoption for the terrestrial code, and then we will talk about the work program. And after the break, we will go over the documents submitted for approval bullet by bullet. Do I need to move the slides? Yes. So introduction. Allow me to go over the members of the Commission for Terrestrial Code. There are 6 of us, like every other commission of specialists. And the people who are members of this commission have been there for quite some time. Myself, I've been with the commission for quite a while. But again, the mindset has never changed. We are still very much work-focused. We are very dedicated. We really are dedicated to this work, and I would like to, well, not just mention the names, but rather I would like to thank the countries and the people those members work for, because allowing them time to sit on the commission is obviously very important for us. So I'd like to thank their employers as well. It's important that we have members who are both skilled but also available. And that really is something I would like to highlight, because again, this year we have seen how available they were. Not only did they participate in the meetings, There were in-person meetings in February and September, but they also attended ad hoc group meetings or the exchanges that took place between the in-person meetings. Sometimes we exchanged information in writing, but we also participated in virtual meetings, online meetings. Sometimes we had to help the experts and the secretariat work with the ad hoc groups in order to elaborate document drafts. Here we have 4 examples of ad hoc group meetings organized this year, to which our commission participated. The last one was the one on disinfection and insectization, which took place earlier this month, but also emergency management, zoning, and harmonization of AMR surveillance and monitoring programs. So we try to work together with the experts. We also attend relevant regional or international meetings. We attend those regional meetings to advocate for more participation of the member states to the new standards setting, and we want them to participate in the process. It takes time and it means a lot of work, and we then introduce our reports during the webinars. I'm the one delivering the presentation for the reports, but my colleagues from the Commission are there to support me. So we work all year round. And in September, recently we calculated with Dr. Montserrat, but it means, you know, a few dozen days, several dozen days of work over the year. And I'm sure you are going to come up with some very good applicants for the coming years. We also work in connection with the other specialist commissions, scientific commissions for animal diseases, of course. We have a very tight relationship with them. We talk all the time, very often. The bureaus met in February. The bureau is the chairman and the 2 deputy chairpersons. So we meet in person to define our working program. What do we do now? What do we want to do in the future? And we try to harmonize our programs to be in synergy. And we also organize meetings on very specific chapters. And when we need to go more in depth on one specific item, then we can obviously cover the item during the meeting. And also during the year, we organize online meetings that are not really in our normal working program. And we have asked the Scientific Commission to work specifically on some chapters because we needed a more in-depth scientific opinion. And this is where the Scientific Commission's work means a lot to us. We also work on with the Biological Standards Commission, the Laboratory Commission as well, as it is called. The Biological Standards Commission is the commission we work with to define cases, also to work on sensitive animals, host animals, and sometimes we have to discuss the tests being conducted for surveillance purposes, or when it is necessary to exchange animals between countries. We also have an annual meeting, and the last one took place in September. With the Aquatic Animal Health Standards Commission, we also have increasingly frequent relationships, and I'm happy about that, especially with regard to across-the-board items. You just had a demonstration when you heard the report from the chairperson of the antimicrobial resistance group. We really want to work on imports, exports, disease notification, services, animal health services, aquatic animal
health services. We try to work together because we want our horizontal items to be aligned so that delegates from the countries can work together in the two realms, the aquatic and the terrestrial realm. And Dr. Carrez showed us earlier that they often merge the aquatic and the terrestrial realm. They often merge because we have discussions on this, and we also have discussions on diseases or problems that are common to the two environments.
Donc, vous avez vu tout à l'heure, je ne vais pas y revenir.
You saw this earlier. I'm not going to go over the work with the working groups. There is a working group on antimicrobial resistance. There's a working group on wildlife. You heard a beautiful presentation by both of our colleagues, so I won't really dwell on the topic. We're absolutely thankful for the work done by these two groups, and we're very happy that the President can help us with sometimes technical items that are remote from our skills and knowledge. And sometimes those topics are new to us, and it's very important that we can work with those working groups in order to be able to set the standards. Part of their work has nothing to do with the standards, but part of their work also has to do with the standards. So it's important that we work together. Before I show you the text that we're submitting for your approval, I would like to highlight that it is meaningful. It means a lot to us that we work well. And this work means that we have to have many contacts with many people, interactions with quite a list of people. And I would like to thank the other 5 members of the Commission, because every time we asked for their help in private or in group, they came. They immediately said yes. And yet, sometimes we have different time zones from Canada to Australia, going through Japan, Africa, and Europe. So we have different time zones in South America. Obviously, our Argentine colleague happens to live in Europe, fortunately, but still there are different time zones, and yet some of our colleagues will get up really early or will go to bed very late in the evening to be able to attend online meetings when it suits everybody in the Commission. So I'd like to thank them for that, because we set our meetings on CET time, and they attend the meetings no matter what time it is in their country. So I'd really like to thank them for that. Now, I'd like to go over the text to be proposed for adoption. And as I said, after the break, we will go over them one by one. This year is going to be a relatively light year with regard to the number of texts being proposed for adoption. I'm not talking about the substance, but rather the number of annexes. And there are chapters which were in progress and have been in progress for quite some time. They were on the working program. We will go over the working program at the end of my presentation. I just want to highlight the fact that we asked the Secretariat to work with us on the Chapter 4, Prevention and Control of Diseases, and Chapter 5, Imports and Exports. And a lot of work was carried out by the ad hoc group or the individual experts. And it means that now we have a really new chapter on biosecurity ready for adoption. And there will be in the future another chapter on disinfection, thanks to the work conducted by the ad hoc group. So that's very useful, because we have data, we have recommendations ready, so that we can help you and guide all the member countries.
And biosecurity and measures for imports and exports were key points to maintain a good status level for animal health in the world. Last year, we adopted a chapter on the slaughtering of animals, but some points were still pending and they were still under study. So we're going back to this year to complete the final adoption of this chapter. We also have some bits and pieces and few details on 2 diseases, on foot and mouth and swine flu, with 2 chapters, these are chapters for which WOAH issues status. And you will hear the presentation by our colleague from ASCA, Dr. Cristobal, later on. And we had a few points to sort of complete and sort out, to harmonize some points in these chapters and to harmonize them with chapters that were adopted last year. So I'll say more about it later. It's not a full chapter. They're just some articles that are presented to you following what happened last year. And then we'll continue with the work that was undertaken with the Department of Disease Notification and the Scientific Commission and the Laboratory Commission, in order to have a better definition of the cases of listed diseases, to enable member countries to better report, declare and follow up their duties to report disease. And there are quite a few diseases for which there was absolutely no chapter, or there was a chapter but there was no case definition, or the case definition was too old and needed to be updated. And so there has been a lot of work on the knowledge, and we talked about here last year and the year before, and we've been working on this plan. And this year we have a brand new definition for tularemia, filariasis, and this specific disease already has its own chapter, which had been developed to a certain extent, and we're going to work and adopt a new case definition, and a few amendments will be made, and they are following the new definition, but still the chapter needs a general update, and we will ask you to adopt this chapter, and having in mind that the chapter is not fully satisfactory because it's quite sort of old and obsolete. So we've worked on it, and experts will work on it so that we have a better chapter on tularemia. For Crimean Congo hemorrhagic fever, there was absolutely no chapter, and it was because we lacked of data to facilitate the identification of this disease among animals who have very few clinical signs. And there was a discussion with colleagues from the reference labs and from the labs who are very familiar on the diagnosis of this disease among animals, in order to develop a new chapter with 1 article, but we have chapters with 1 article on this chapter on the definition of the case. So same again with the bird disease, which had a strange name. It's the infection with metapneumovirus, avian virus, and there was no case definition for this disease. Just a reminder, before we started working on a case definition, the Scientific Commission and ourselves have worked on this disease that is chapterless. So if it's chapterless, should it remain listed? So each time we have to do specific work, and you did this in the February report and the previous report, we have to check whether this disease should be listed or remain on the list. So based on the number of reports or declarations that are made, on the data that we have, the new analysis that have been submitted on the impact of these diseases, with the chapters that were then adopted, and how we should evaluate the impact of the diseases. Well, these diseases are regularly reviewed, and as soon as they're considered as eligible to remain in WOAH's list, then we can initiate the work on the case definition. And then there were 2 appendix that that refer to the appendix for the specific chapters. So there's an appendix on the glossary. So each time there's a work on a new area, this brings additional reflections to find out whether some topics need to be specifically defined in the code or if the general definition from the dictionary actually suffice. So we may have amend or create new definitions that are submitted to adoption for adoption in the glossary. And every year the glossary is updated with amendments or add-ons, or sometimes with the deletion of some definition. Same applies to the WOAH's list for the, WOAH's listed diseases. I mean, it's a chapter that is quite specific because it's only a chapter with 23 of a list of chapter 1.3, sorry, it changes every year because the name of the diseases may change when there's a new name for a disease. Obviously, the order in the list changes, and sometimes a disease which was just a group of species turns out becomes a disease for multiple species. So this also changes the order, and they come up with you with the list of diseases that needs to be reviewed. This is what will be submitted for adoption after the break. Now we're back to this. So to try, for the purpose of saving a bit more time, I will move directly to the working program. So these slides are kept for later. I mean, I'll try to skip a large number of slides. I apologize. I think within just 10 minutes, we could have a quick overview of the working program. So that will allow us to save 10 minutes. So I apologize for this small disturbance.
Oui, il n'y en a pas beaucoup, mais c'est fait quand même.
So quite a few, but it's, yeah. So here we go, work program, the work program. So beyond the text that will be submitted for your comments, so we do have a work program that is always very dense, as you know, but it's always fascinating. So at the moment, we have 71 work items in the work program, and 50 of these are under prioritization. So it's prioritization number 1 or 2. In the appendix, you have the work program and with an explanation on the prioritization process and how we choose to define priorities for every topic. And then we wait until the members respond to our appendix on the work program, and then we can define whether the prioritization level is appropriate or not, or if you feel like some subjects should be considered as a higher priority than others. It's important to have this, otherwise it's quite vague. So we have quite a few number of points that are still being discussed, and many of them are being coordinated with other specialist commissions. That is why we need to coordinate with them to find out how we can actually progress without, waiting too long. Waiting for too long. So for the February meeting, we had 13 texts proposed for adoption, 18 texts circulated for comments, and there are 3 new proposals and 4 new work items were added to the work program. As previously said last year, these topics have been added because members asked for it, or because a resolution requires it, because there was a previous meeting in the regional commission. There was like a global meeting with a global conference, and the resolution imposes us to work on some topics that are still not in the work program. So we include them then in the work program, and then we include them as shadow points, but then we include them fully transparently when it becomes important. So to this day, things have landed in the work program, but still they are not submitted for comments because we are currently working on them. Experts are working on them. We've had discussions with experts in the other commissions. There's the revision of disinfection and disinfection chapter, and the ad hoc group met at the beginning of the month, and encephalitis, horses, and equine encephalitis, this disease. For this disease, we've made some progress, but others are also under progress. There's the Western Nile fever virus, and there's another chapter, and it's a continuation of the work on import and export. So you will adopt an additional 4 new chapters on procedures, but we also have chapters on certification and certification models that are currently being reviewed, because the member states asked for more clear guidelines and recommendations, and with a more sort of useful type of guidance. And chapters 6, 8, you heard of it earlier on with the antimicrobial resistance work group. And we also have an addition, because we will review the chapter on Ojeski's disease virus, and the revision hasn't started yet. We haven't started the work, but as you know, we've worked on the case definition, and the scientific commission suggested, sorry, a new case definition. So realized that there was an impact on the disease. So we'll review the entire chapter. There are brand new chapters on which we will work, and I just wanted to insist on the crucial role of the ad hoc groups and their chairpersons. That is why here you can see the list of all the ad hoc groups that are currently working, and for each ad hoc group you can see the chair. And these people, you know, take time out of their working time. They're not unemployed, they work a lot, and we'd like to thank them for this, for their dedication. And I really encourage members to suggest more experts from their countries to encourage them to work in the ad hoc groups. So when we say, okay, an ad hoc group is about to be set up, members should react, because in your regions you have experts who are very capable of helping, and they should be involved in the development of standards. So more ad hoc groups, you can see they're quite numerous, and they're not for free. You should note this down. It's important, I was told to say it. Each time you ask for ad hoc group, say, okay, Etienne, it's not free. It doesn't come out for free. We need time. The secretary needs time to set them up. So there's a whole coordination work behind the scenes that is necessary. It just doesn't happen overnight. We need money. So we need more money for more ad hoc groups. We may have dedicated money, or general funds may even be better. So I am a strong supporter of my WOAH colleagues, so that, you know, members have to realize you can't afford to have science-based standards that are solid and usable without tedious and costly work behind the scenes in order to set up projects. So these are the appendix that have been circulating. It says 17, but on the next slides it says 18. So there's a major typo, because there was 17 and 18. I have to tell you, there are 17 annexes, because sometimes some annexes are double, are replicated. But a huge amount of work has been made on the user's guide. You don't need to adopt it this year, because the adoption took place last year. So we've been reworking it a lot. There has been a lot of queries to sort of add more data to this user's guide to make it more useful. And a few things may no longer be useful in the chapters as long as they're in the user's guide. Glossary, of course, very important. Notification, we talked about it yesterday. We will review the notification following requests from some of our colleagues, and a few things need clarification, and countries need more clear clarification recommendations. And procedures chapter for the recognition of a status or the self-declaration of animal health status. This is absolutely instrumental. And the chapter on emergency management, a chapter that is of crucial importance in zoning and compartmentalization. These are hot topics. 2 topics on animal welfare. They've been on the list for quite a long time now, and we suggested, submitted a chapter for comments. This chapter is on transport, and there's another chapter on slaughter. So these two chapters are very important. So we have a huge package here. So, dive in the appendix and start working so that the comments can be ready before the 3rd of July. That is the deadline that was also previously mentioned. There is another list of chapters for which you will be required to submit your opinion. And these are quite hefty chapters, especially with lumpy skin disease and the goat pox. Sheeppox. So follow the guide to submit your comments. The QR code may be scanned or on the site. Everything is available from the website. So please feel free to visit the website, and then you can, have your comments accounted for. Good comments, but if you don't prepare them well, if they're not well submitted, they may not be accounted for. So make sure you submit them in the right manner. Okay, I see you later, and thank you very much.
Thank you, Etienne. It was very clear, very detailed. Thank you for preparing this presentation so well. So I open the floor if there are any comments. Brazil, Australia. Starting with Brazil.
Hello. Thank you, Madam President. Representing the 33 members countries of the American regions, I'd like to thank you the continued and dedicated work as outlined by the Commission's work program. We highly appreciate the opportunity to comment on new and ongoing work program items, and particularly the Commission's recognitions of regional priorities of the Americas, including the review of the Article 10.9.3 in the Chapter 10.9 of Newcastle disease. Newcastle disease virus can cause a significant avian disease in our region. We look forward to further participation in the review of the process of the chapter and others as well. Thank you so much for your commitment and work.
Thank you so much, Brazil. Now Portugal.
Thank you. Thank you, Madam Chair. I speak on the behalf of the 27 member states of the European Union. The EU commends the Code Commission for its continuous efforts to prioritize its demanding work program and appreciates the coordination with other specialist commissions. The EU fully supports the revised work program and its prioritization. The EU supports the ongoing review of the official status process and recalls the importance of including all the resulting procedures within the WOAH standards, in particular Chapter 1.6, to ensure transparency and oversight by members. For more detailed comments on the work program, we refer to the written comments of the EU, which will be submitted to OAH in due time, ahead of the September meeting of the Code Commission. Thank you.
Thank you, Portugal. Now Australia.
Thank you, Madam Chair and Etienne, for the presentation. I speak on behalf of the Animal Health Quadrilateral Alliance. The Quads Alliance commends the Terrestrial Code Commission and Ad Hoc Group on veterinary emergencies for their work on the draft chapter on emergency management. While we note consultation on this chapter is still in the early stages, the Quads Alliance considers its development to be timely and important undertaking. Emergencies affecting animal health, welfare, or veterinary public health are becoming increasingly complex. Practical emergency management standards that encompass collaborative, multi-sectoral approaches are essential to support members in addressing these emergencies. The Quads Alliance looks forward to contributing constructively through the consultation process and encourages other WOAH members to do the same. Thank you.
Thank you, Australia. Are there any other? South Sudan, yes.
Thank you, Chair. Sudan appreciates the tremendous technical efforts made by WOAH and the specialist commissions in preparing these proposed texts for adoption under the Terrestrial Code. Sudan particularly welcomes the emphasis on biosecurity, animal welfare, border inspection system, quarantine management, and disease prevention and surveillance. For countries such as Sudan, which possesses one of the largest livestock populations in Africa and significant export potential, these standards are extremely important for strengthening international trade, improving food safety, protecting animal health, and increasing global confidence in livestock exporting countries. Sudan also recognizes the growing importance of preparedness against terminary diseases, including foot-and-mouth disease, Crimean Congo hemorrhage fever, avian diseases, and emerging zoonotic threats. At the same time, we emphasize the importance of supporting developing countries through capacity building, laboratory strengthening, veterinary training, technology transfer, and sustainable financing mechanism, so that implementation of these standards become achievable and inclusive. Ladies and gentlemen, today, the tension in the Strait of Hormuz resulting from the conflict between the United States and Iran, together with increasing oil prices, have significantly increased logistic costs, shipping costs, and insurance premium worldwide. As a result, food imported from distant regions such as North America, South America, Europe, Australia, and the Far East is becoming increasingly expensive for GCC countries. The GCC countries import food products valued at $100 billion annually. $100 billion annually. This situation creates a strategic opportunity for Sudan. Sudan enjoys a major geographically advantage. Port Sudan to Jeddah takes only about 10 hours by sea freight and approximately 50 minutes by air. Therefore, the increasing in logistics and insurance costs affects Sudan much less compared to distance exporting countries. Sudan is therefore well positioned to supply livestock, meat, dairy products, poultry, fish, and other food products to GCC market at a higher competitive price. We are also prepared to cooperate with international companies that traditionally export food from distant countries to the Gulf region by encouraging them to invest and produce food inside Sudan for regional market. Sudan remains committed to strengthening veterinary services, quarantine systems, export slaughterhouses, disease surveillance, and livestock value chain.
I'm sorry, I need you to conclude, please.
Yes, just 30 seconds. We believe that compliance with international animal health standards is not merely a veterinary obligation, but a strategic gateway to food security, economic transformation, sustainable rural development, and safe international trade. Thank you very much.
Thank you, South Sudan. Before the break, do you want to say something, Etienne?
Very quickly, and globally, if you don't mind, and I hope the members will, the delegates will forgive this from me, I will just say that yes, all these comments are very relevant. We are working on those aspects that you have highlighted just now. Please, if you need, as was saying by Australia, more impetus in some of the topics that we are dealing with, don't hesitate to send them your comments in writing so that we can discuss within the Code Commission, but also with the colleagues in the Secretariat, how to organize our planification and our work program. So all this is taken into account. Thank you very much.
Thank you, Etienne. We will now have a break. 30 minutes, please be on time, and we need the quorum for the rest of the discussion, as you already saw for the presentation from Etienne. So I wait for you at 11:40. Thank you. We don't have. We still don't have quorum. We need more. We have 87. We need 93.
Still beeping. Can you hear beeps?
One more and that's it.
We need one more. I ask the regions if you can call your colleagues from the regions. We are missing one to start the works.
If you are not scanned, can you go and For those that came in and are delegates and were not scanned, can you please go and get scanned? Because otherwise your presence here is not counting for the quorum. Sorry for that.
We only need one, so if there is anybody here that was not scanned, we have 93, so okay. We are ready to start, so welcome back. Quorum is confirmed, so I'll give now the floor to Etienne. Go ahead.
Thank you, Madam President. So, as I told you just before the break, we will study now the 13 annexes out of 10 points that you have in front of you, just to explain that again, the Annex 5 and Annex 6 on glossary and chapter on disease listed would be done at the end, like we do always, because sometimes these annexes are depending on the adoption of the chapters themselves. So we will begin by the Annex 7 of our report on biosecurity. So we have developed this new chapter with guidance to really have a better recommendations on biosecurity and defining a better way, introduction, and purpose and scopes, general principles, roles and responsibilities of all the actors of the biosecurity. It's a very wide and inclusive chapter. It was not narrowed to a specific point of biosecurity, but really the widest possible, and I think it was very well received by the members. And we tried to look as much as possible on the possible pathways and the measures to avoid the pathways. But again, this is not a textbook. This is not something to bring on a field. It is really general recommendations for the members to build their biosecurity and for actors to build their biosecurity plan. So it was circulated 4 times since, it has been circulated 4 times since September 2023, 3 years ago. And so now we think it is really ready for adoption. The last comments we received between September and February were very supportive. So that's why, Mrs. President, I think we can, with further ado, propose this chapter for adoption.
Thank you. Thank you. It's not, okay. Thank you, Etienne. As you mentioned, we propose this standard for adoption. So are there any objections?
Or interventions.
Oh, sorry. You are right. First, the comments. Any comments or any questions that you may have? Ireland, Thailand, starting by Ireland. In the middle.
Thank you, Madam Chair, and Etienne for the presentation. I speak on behalf of the 27 member states of the European Union. The EU notes that this chapter on biosecurity has been circulated several times and appears ready for adoption. We thank the Code Commission for its work and its improvements made throughout the consultation process. The EU has limited its comments to a few targeted points as reflected in our written submission. In particular, for Article 4(x)(2), we suggest explicitly taking into account the pathways for both introduction into and release from the population to ensure alignment with other parts of the chapter. For Article 4(x)(3), the EU has concerns regarding recently proposed added references to the adaptation of biosecurity, the availability of resources, as this risks weakening the baseline requirement for effective biosecurity measures. Finally, with regard to Article 4(x)(8)(d), the EU questions the recent proposed deletion of the reference to relevant emergency response procedures. As such, elements remain important for ensuring preparedness and should be retained. We refer to our written comments for further details and remain supportive of the overall approach.
Thank you, Ireland. And someone asked me the floor. Yeah, okay, go ahead.
Thank you, Madam Chair. Thailand appreciates the work of the Territorial Commission in developing the new biosecurity standard under Chapter 4.x. We recognize biosecurity as a key foundation for effective prevention and control of animal disease. Thailand in general supports the adoption of this standard. Noting its practical, science-based, and risk-oriented approach, we would like to propose a minor amendment to Article 4.x.8, Section D, on the description of biosecurity, in addition to corrective actions in response to biosecurity breaches. We believe that prevention measures should also include to reduce the likelihood of recurrence. Therefore, we suggest adding the phrase and further preventive measures after the words corrective actions in the second line. Thank you.
Thank you, Thailand. Any other comments? I see none. Do you want to say something, Etienne, before the proposal?
Yeah. Before, since there is two comments on the same article and on the same point of the same article, can Thailand again express the two words they want to add after the word corrective actions?
Can you recall the article?
Article 4(x)(8)(d),
yes.
description of biosecurity, yes. And I think it's the first sentence.
And further preventive measures.
And further?
Yes, preventive measures.
Preventive
measures.
Measures. Okay. So then, if you allow me, Ms. President, I will begin by this point because then we will have a better opinion. So the Code Commission changed this point D in February in response to some member comments that we wanted to have a better, I say, expression of what was expected from the actors and the better relation between the Article 7 and the Article 8. So that's why we put that corrective action in response to biosecurity breaches. I agree that the members did not request the deletion of the sentence, but we thought that having added this part was kind of integrating the sentence. However, now I see that you have two comments on the corrective actions. So if everybody agrees, very few changes could help dealing with the Thai and the EU comments, including corrective actions and further preventive actions in response to biosecurity breaches and, and procedures for emergencies. So the section should describe the relevant components of biosecurity in accordance with Article 4X7, including corrective actions and further preventive measures in response to biosecurity breaches, and procedures for emergencies. Would this too little change get the agreement of the delegates of the Assembly?
Back to you, delegates. We would like to ask if you agree with this with these minor changes that we are making.
I think it's clearer that way. It's a little bit more complete. It includes both. I think corrective actions would include, in fact, preventive measures, but let's say we put this for clarity. Okay. Then I hope we have well noted this. Okay. I come back to the second comment of EU. The availability of resources is always. Article 4X3. Point. It's the last sentence of this Article 4X3. The change was included in response to comments from a region, and we found it indeed relevant to highlight at some point in this chapter, that biosecurity is not an absolute value. It has some consequences in terms of investment and in terms of investment and resources. And so it was deemed appropriate to add the availability of resources there to show that even though there is no resources or there is scarce resources, it's possible to adapt the biosecurity measures because should be adapted to the settings and the availability of resources. So it's just to show that adaptation is key in biosecurity, adaptation not only to the epidemiology, not only to the animals, but also to the situation, and the situation is the settings and the availability of resources. So I think we should keep this point. The first comment of the EU was on the Article 4X2. I think it's the third indent of the third paragraph of this Article 4X2 about the sources and pathways, as I said in the introduction, involved in their introduction into and transmission within the population. We looked at it with experts because indeed it was not only about transmission but also introduction. However, it's true that the definition of biosecurity in the glossary says that biosecurity is a set of measures to prevent the transmission of pathogenic agent into, within, and out of. So I would agree that it's possible to say, to add and from, within and from the population. This is a logic that can be followed, and even though we are focusing a lot in the chapter on the transmission by introduction or within, it is a reality that biosecurity also deals with that. So I would propose to add and describe the potential source, etc., their introduction into and transmission within and from the population.
So we have two amendments, one in Article 4X2 and the other in the Article 4X8. And I would like to hear if there are any comments. Okay. Etienne?
Then we propose that modified draft to be proposed for adoption.
Okay, we have quorum. And so the standard is presented for adoption. I ask if there are any objections. None, I can't see any objections. And any abstentions? Are there any abstentions? Okay, so I confirm the adoption by consensus.
Thank you, Mrs. President. It's a big new chapter. And then we align a little bit with the aquatic people who have done that before us, so it's good. So now I would propose, if you don't mind, to have 4 annexes together. The chapter is not really easy, but for you, but there is a logic, because the chapters 5.4, 256, and the chapter 5.7 are a group of chapters that have been worked on by the same other group. It's measures and procedures applicable to the exportation, transit, and importation. So 5.4 is exportation, 5.5 is transit, and 5.6 is importation. And there is a specific chapter 5.7 on the border inspection posts and the quarantine centers. So these also have been circulated a lot of times, and at the same time around 3 years, but they have been circulated 5 times. There was 2 or 3 meetings of the ad hoc group, and it tends to really give better guidance for members to organize their services at export and import, and to really give the roles and responsibility to all. Now the comment again were supportive, so we propose these 4 chapters, 5.4, 5.5, 5.6, and 5.7 for adoption.
Thank you, Etienne.
But, sorry, if the members want to have intervention by chapter, it's possible.
Okay. Perhaps it would be easier. So floor is open to hear your comments or interventions. Hungary, Thailand, and Kenya. So Thailand was the first one, and Kenya.
Thailand.
Thank you, Madam Chair. Thailand had a concern on the non-commercial movements of personal communities, which addressed in the first paragraph of Article 1 of Chapter 5.4 to 5.7. With respect to the importance of the non-commercial movements in the relation to the introduction of animal disease. However, the current text in Article 1 that adds the term non-commercial after international trade may lead to confusion. For example, when individuals take their pets or food with them while traveling, these movements are not commonly defined as having a trade purpose, nor do they involve trade volumes. Therefore, we propose to retain original text in the first paragraph of Article 1, Chapter 5.4 to 5.7 by deleting the term commercial or non-commercial after the term international trade. Thank you.
Okay, now we are going to hear Hungary.
Thank you, Madam Chair. My intervention concerns Chapter 5.7. I speak on behalf of the 27 member states of the European Union. The EU thanks the Code Commission for its work on this chapter on border inspection posts and quarantine centers, and acknowledges the extensive consultation process. We welcome the work undertaken by WOAH on the cleaning and disinfection procedures, which we consider of key importance and closely linked to several aspects of the code and this draft chapter. In this respect, the EU is ready to support this activity by WOAH. Given that the text has been circulated several times, the EU has limited its comments to a specific point on culling operations in Article 7 of the current chapter, as reflected in our written submission. The EU, in any case, supports the adoption of this chapter. Thank you.
Thank you, Hungary. And now we are going to listen. Kenya, the floor is yours.
Thank you, Madam Chair. I speak on behalf of the 54 Africa Union member states that are also members of WOAH. Africa thanks the Code Commission for the extensive work on chapters 5.4, 5.5, and 5.6, and supports adoption with comments. Africa's comments focus on implementation, clarity, veterinary assurance, and safe trade. For Chapter 5.4, Article 5.4.2 on general considerations, Africa requests clarification on sanitary requirements used for export certification should be officially available, transparent, regularly updated, and accessible to the exporting veterinary authority and relevant operators. This will improve predictability, reduce avoidable non-compliance, and support fair application of importing country requirements. In the same article, where the text addresses suspension of exportation, Africa proposes that any suspension or restrictions should be risk-based, proportionate, and limited to the risk identified. For Chapter 5.4, Article 5.4.3, on official controls for exportation, Africa supports progressive use of electronic certification systems where available and appropriate to strengthen traceability, reduce fraud, and improve efficiency, while recognizing that implementation should be capacity sensitive. For Chapter 5.6, Articles 5.6.2 and 5.6.3 on importation, Africa requests that import procedures recognize equivalence where appropriate, avoid unnecessary duplication of controls where adequate sanitary assurances exist, and apply inspection frequency and scope on risk basis. Africa further supports adoption of Chapter 5.5 on measures and procedures applicable to the transit of commodities with comments. Africa wishes to focus on Articles 5.5.4 on planning for unexpected events. Africa requests clearer guidance on the responsibilities of exporting, transit, and importing countries when unexpected events occur during transit, including delays, unplanned unloading, veterinary emergencies, logistical disruptions, or interruptions of critical services. Africa further requests that the chapter clarify that transit requirements and decisions taken during such events should remain risk-based, proportionate, and not more restrictive than necessary. This clarification would help maintain sanitary assurance, reduce disputes among authorities and operators, and support continuity of safe trade under practical transit conditions. I submit. Thank you, Madam President.
Thank you, Kenya. Are there any other comments? No. Back to you, Etienne.
Thank you very much, Madam President, and thank you for your comments. Okay, I will comment first. I will answer first to Thailand. The change we made in February was exactly for the reasons that are proposed by Thailand for retaining the wording. In fact, the definition of commodities would not very well include the possibility of having, for example, pets or animals that are moved with no commercial prospect. And that's why, instead of commodities, we said commercial or non-commercial instead of the trade of commodities. we may continue our work. There is a work ongoing on what is a commodity. We will work on that with our colleagues in the Code Commission. However, at this stage, I think it was very relevant for the moment to use the word commercial or non-commercial to be sure that it includes not only some commodities that are part of a commercial trade, but also objects or animals or products that are moved by individuals or by groups without an issue of trade, of commerce, but are a risk for export or import. So this, I think, it was explained in the report, and I think we should not change that at the moment. That's for the Thailand.
Maybe asking to Thailand if it's clear. Yes? Okay. Go ahead.
I'll finish the comments. The comments from Hungary on behalf of the EU is on chapter 5.4, no, 5.7 at the end of the chapter 5.7. They said 5.7.7. 5.7.7 at the point 10. It's about, and thank you for having sent this in writing in advance so that it's easier for me to answer you now while trying to keep the time. We have the necessity to put in the quarantine centers some necessary material and procedures to deal with the animals that are in this center. For the moment, we say restrained handling, isolation, and intervention, such as sample collection, testing, vaccination, treatment, and veterinary inspection. After having looked at this, it's true that the animals, when they need to be killed, you need to have something to kill the animals. We don't use the term culling in the code. We use the term killing when it's a necessity to kill. And the veterinary inspection should be, in fact, the first intervention that is done by the vet services. So it should be including veterinary inspection, sample collection, testing, vaccination, treatment, and killing. If you agree with that, the addition and the change of the place of the word veterinary inspection in the first place. So it's at the end of point 10, the last phrase, or relevant disease-specific chapter of the terrestrial code, including veterinary inspection, sample collection, testing, vaccination, treatment, and killing. And there are other places in the chapter that deals with the relation between this killing and the section 7 on animal welfare. Now I turn to the comment from Kenya on behalf of the 54 members of African Union members of WOAH. I have just a problem here because all these comments are not meant to be done on the last version that was sent in February. And so I wonder why we did not receive these comments between our September and February meeting, because I hear, because I have not read the written version, but I hear in these comments a lot of potential relevant, but it is not possible now, in the last 14 minutes we have, to decide whether or not to change this text. And we had no occasion to discuss that with the Code Commission. It's just not a detail. So what I propose is that this is sent in writing, and we will see that with our colleagues in September, but we cannot have this sentence. And again, these very good comments, it is too bad that they have not been sent after our September-October report, so that we could have looked at them in February and come with a version that addresses them today. So with that, I would agree to put that for adoption, and the African members can send us by writing the comments so that we can look at it in September.
Okay, back to you to hear your interventions. No interventions. So, okay, so we are ready to propose chapter by chapter for adoption, starting with 5.4, proposing for adoption. We have quorum, so are there any objections? No. Abstentions? Okay, I confirm the adoption by consensus. Chapter 5.5, Measures and Procedures Applicable to the Transit of Commodities. And I ask if there are any objections. No. And there are any abstentions? No. So I confirm the adoption of Chapter 5.6 by consensus. And now? 5.6, yes, by consensus, okay? Next.
No, it was 5.5. Now it's the new one, 5.6. Yes, of course.
Okay, next one. Let me correct my document. Okay. Now, 5.6, proposed for adoption, measures and procedures applicable to the importation of commodities. And I ask if there are any objections. No. Any abstentions? No. So I confirm the adoption by consensus of Chapter 5.6. And now the final one, Chapter 5.7, Border Inspection Posts and Quarantine Centers. And I ask if there are any objections with the little changes that we already mentioned. No. As I ask if there are any abstentions. No. So I also confirm the adoption by consensus of this 5.7. So thank you. And I also would like to highlight that, as Etienne mentioned, the good comments that Kenya shared with the Assembly should be sent to the Code Commission. Yes, yes, you can give the paper to our Secretariat.
Yes, and taking into consideration the fact that for equivalence, the Chapter 5.3 is going to be revised, so the points on the equivalence, on the risk-based, etc., this is to be addressed in the next phase of work of the Code Commission in any case.
Okay.
So, Mrs. President, we move on then with the next Annex 12 of the report, which is only one article, the Article 7.530, and even within this article, only one little aspect that was left for under study last year. It's about the water bath stunning for poultry. We adopted in 2024. We worked on this chapter. We worked on this article. We had a lot of documents that were revised, were sent by some delegates and were revised by some experts. And eventually we found out that this could be solved, this issue of understudy could be solved by some not big wording, but wording that could address the issue and the comments. So in that respect, I propose this article revised with these small changes for adoption. It was already circulated 3 times too.
Thank you. Etienne, open the floor to hear your interventions. I have Thailand, New Zealand, UK, China, and Ireland. So, Norway. Okay. Starting with Thailand.
Thank you, Madam Chair. Thailand wish to reiterate our concern regarding the electrical parameters. We recognize the importance of the establishing recommended parameters based on robust scientific evidence. However, there should be sufficient flexibility for the members to adapt or apply alternative parameters that achieve equivalent animal welfare outcomes. Should the minimum parameters remain in the code, we propose adding the text to clarify that the recommended parameters are based on a trial using a specific waveform such as child wave alternative current. We also propose removing the paragraphs which limit the use of high-frequency systems and adding the following sentence as a final paragraph. The course provides recommended combines of frequencies, currents, and species that are known to be effective based on scientific evidence. Members should adapt these recommendations to their operation context. Thank you.
Thank you, Thailand. Let's hear China. Yeah, please, Mike. Thank you.
Sorry. So China highly appreciates the Commission for seriously considering and adopting some of our comments. And with regard to the provision on the electrical stunning frequency parameters just mentioned, yes, China endorses the proposed amendments put forward by Thailand before. And we also discussed this question on the regional position. And we support adoption of the corresponding revisions for the alternative frequency parameters.
Thank you.
Thank you.
Thank you, China. Now let's hear New Zealand. You have the floor.
New Zealand supports the objective of the chapter to promote good animal welfare outcomes at slaughter. Wording in the Code chapter that creates clarity on the use of alternative parameters when scientifically proven will further strengthen this objective. We request amendments to the article that ensure it's outcome-focused, inclusive, and trade facilitating by allowing for alternative, scientifically robust stunning parameters. And so we request in point 3 of the article removal of the text, in general, lower frequencies ensure an effective stunning, while higher frequencies provide the lowest probability of a successful stun, as members should be able to provide scientific evidence for their context. And the addition of the following sentence at the end of point 4, which makes clear in the chapter that alternatives which are scientifically supported are acceptable. Alternative parameters may be used when scientifically validated and demonstrated to produce an effective stun in the species concerned. Thank you.
Thank you, New Zealand. Now, UK, you have the floor.
Thank you, Madam President. The United Kingdom thanks WOAH for its extensive work in revising the chapter on animal welfare during slaughter and for constructively considering the comments that the UK submitted. Given the importance of this article, the UK welcomes the refinements introduced which reflect and align with the available scientific evidence. We wish to reiterate that electrical water bath parameters should only be agreed where they are supported by robust scientific evidence. This is essential to ensure that the parameters adopted reliably render animals unconscious rather than merely immobilized, thereby safeguarding animal health. Evidence demonstrates that this concern is particularly relevant in the case of high-frequency currents, and the UK therefore considers it important to retain wording that reflects this. However, we also suggest removing the phrase "in general," as the evidence base already substantiates the statement that follows, and the additional words may inadvertently weaken its clarity. The UK's support for adoption of the proposed changes is therefore contingent upon wording that maintains alignment with effective stunning practices and scientific rigour. Thank you.
Thank you, UK. I can see Bahrain.
Yes, thank you.
The Kingdom of Bahrain welcomes the continued recognition of slaughter without stunning for region's purpose and stress that the provision is essential to respect the culture and religion's practice, ensure food security with Muslim communities, maintain compliance with halal requirements. Bahrain notes the importance of ensuring the code reflects accurate and up-to-date scientific evidence. In this regard, Bahrain supports the clarification that loss of consciousness following proper severance of the court arteries may occur rapidly. Scientific interpretation should not assume prolonged pain without clear and conclusive evidence. Bahrain emphasized that the scientific neutrality is critical to avoid unintended restriction on religious slaughter. Thank you.
Thank you, Bahrain. I'll give the floor to Ireland.
Thank you, Madam Chair. I speak on behalf of the 27 member states of the European Union. The European Union thanks the Code Commission for its work on Chapter 7.5 on animal welfare during slaughter, adopted in 2024, and acknowledges the extensive consultation process on Article 7.5.30 concerning electrical water bath stunning for poultry. As the text has been circulated for consultation several times, the European Union has no further comments. The EU supports the adoption of Article 7.5.30, which reflects the latest scientific evidence.
Thank you, Ireland. Any other comments? No? Where? Norway. Sorry, you already asked for. Yes, Norway.
Thank you, Madam Chair. I speak on behalf of the 4 EFTA countries, Switzerland, Liechtenstein, Iceland, and Norway. We would like to thank the Commission for its work on the revision of Article 7.5.30 concerning electric water bath stunning of poultry. We strongly support the adoption of this article. In particular, we consider it important to maintain the specific values for electrical frequency and intensity for the different species. These are necessary to ensure an effective stun and loss of consciousness. Without these values, it's not possible to know whether the animal is properly stunned or just immobilized. Indeed, if the stun is ineffective and birds are merely immobilized, though still conscious, we will not know that, as they are incapable of showing signs of pain, fear, or distress. This is well documented in scientific papers. Thank you.
Thank you very much, Norway. I ask again if there are any other comments. No? Okay, back to you, Etienne.
Thank you, Mrs. President. Thank you for your supportive comments to the work of the Code Commission, backed by the work of many experts in the Secretariat, and we thank them again for that. So we are talking about a way of stunning poultry. That's what we are talking about, a way of stunning poultry. And we are giving recommendations for that, for the members to build their rules. What we give is not rules. We are not building a rule for countries. We're giving advice for countries to build their rules. So we don't have the word alternative in our code. We have recommendations, but members are completely free to decide otherwise. As long as the recommendation, which is the root of all recommendations, is that when you stun, it is a stun. That means that the animals are unconscious because stunning is putting the animal in unconsciousness. So based on that, stunning means unconsciousness. We have advised that how to get this unconsciousness. And we propose the best couple between current, voltage, and frequency. Some frequencies have shown scientifically that they don't achieve stunning. Then we cannot recommend them, that's all. But if there are other validated methods that are available for members, they can use them. That's exactly the meaning of the sentence that we have parameters may be validated when the outcome of effectively stunned birds is demonstrated to be met. We're not talking about the parameters we recommend here as a minimum. We're talking about any parameters that the members want to develop in their rules. So we have the sentence that members may do that. We have that also in the user's guide. What we say when we say lower frequency ensure an effective and higher frequency have the lowest probability. So it's not don't. So it's a probability. If this probability is demanded by some study that say, oh, by the way, this is your probability, but I have another, then why not? Its parameters may be validated, etc., etc. Validation means science. It's obvious. We don't need to add here that it is scientifically because it's demonstrated. How can you demonstrate things without science? So here, I think, and again, I don't want to be preposterous in the way we work in the Code Commission, but I think the language exactly means what it means. In general, lower do stun. Higher don't or have the least probability to stun. And eventually, in the point 4, at the second paragraph of this point 4, you have a sentence that was adopted in 2024 that says effective electrical parameters should be based on scientific data with field evidence. You remember we had this discussion last time on the welfare outcomes of different types and conditions of animals in accordance with point 5 of Article 5714, which is the root article of Section 7. Everything is here for members to decide what kind of parameters they would impose or not to their industry. What we say here is that what we know is that higher for this species won't work. So we say it's not recommended, but it doesn't work. We have a proof. And it says also that depending on the frequency, the intensity, the current should be adapted and the voltage. So upon that, I think, Mrs. President, that there is no need to change the text, and we can adopt without fear of being forced to do things or not. We are not here to force anyone. We're just here to give you the best science available to decide in your country. So I'm sorry to say that although I understand very well all the comments that were put in front of us, I would not accept now to change the text, and it will be it will be really bad for also all the colleagues behind. The comment from Bahrain is something that is not under discussion now. It's another part of the chapter. There is an article that deals with the slaughter without stunning. So if the members can send us by written, we will see in the process of correct standard setting procedures how we can address these comments. Voilà.
Okay, I think hearing what you mentioned, that is important to have in mind that our standards are based in science, period. And the other thing that it's important to have in mind that these are recommendations, and I think we should be very aware of that. So back to you again. I would like to hear if there are any interventions or any new comments that you would like to give us, taking into account the answers that Etienne shared with us. Nothing, so I think it was clear. Okay, so let's propose to adoption this standard. Okay, so first we have quorum. Yes, it's here. So I ask if there are any objections to this proposed standard. Okay, and are there any abstentions? Thailand. Any other? New Zealand. China. I see no more abstentions. So I confirm the adoption of this standard with the abstentions of Thailand, New Zealand, and Republic of China. Okay. Back to you, Etienne.
Thank you very much. Thank you, colleagues. Without losing too much time, I will come back to, I'll continue on the chapters for which there were some pending issues last time. And we have two chapters, the chapters on foot-and-mouth disease virus, infection with foot-and-mouth disease virus, and the chapter on infection with classical swine fever virus. I will begin by the one on FMD virus. In Article 883, 884, and 888, the changes that are proposed are here to harmonize the wording with the chapters that were adopted last year on African horse sickness and contagious pleuropneumonia, bovine pleuropneumonia, yes, CBPP, contagious bovine pleuropneumonia. And so it's the same with the article on CSF, Article 15.2.3 and 15.2.5. So it relates to the definition of what is a country or zone free and the definition what is a country or zone infected. So for FMD, there are two articles on freedom because you have freedom with and freedom without vaccination, and an article on the country infected or zone infected. So I think it's quite simple because it has been done in collaboration with the Scientific Commission, and the members adopted the same type of wording last year on the chapter on EHS and CBPP. So I propose those two chapters for adoption, but like the others, you may have some possibility to intervene chapter by chapter.
Okay, thank you. I open the floor to comments, and I have Slovakia. Any other? No, so give the floor to Slovakia.
Yes, thank you very much, Madam Chair. I speak on behalf of 27 member states of the European Union. The EU thanks to the Code Commission for its continued efforts to harmonize official status chapters and recognizes the broader work undertaken within WOAH, including the coordination work done with the Scientific Commission for Animal Diseases. They acknowledge the complexity of this process. The EU supports the overall direction towards a more streamlined and consistent framework. However, we reiterate the importance of ensuring that the annual reconfirmation process remains proportionate and sustainable. In our view, an annual declaration by the delegate and transparent notification obligations should be sufficient where the epidemiological situation and import rules and the condition remain unchanged. We refer to our written comments for further details. In light of these concerns, the EU needs to abstain today from the vote on the proposed changes or Article 3, 4, 8 of the FMD chapter in the Code. The EU understands that the EU concerns of the reconfirmation process are to be addressed as soon as possible by revising Chapter 1.6. Thank you, Madam Chair.
Thank you, Slovakia. Are there any other comments? No. Back to you, Etienne.
Yes, thank you. I take from these comments that the comments are not on the change that are proposed, the very change that we propose to this chapter, so which is good. But it's on another issue in this chapter. It's on the reconfirmation of status and maintenance. Maintenance. In the code, we say maintenance. We don't say reconfirmation. Reconfirmation is a procedure. We say maintenance in the code. So, as I said, and you put it in writing, the chapter 1.6 is on our work program, and we hope to have a revision of this chapter 1.6 for adoption next year. So I really encourage all the members to work on this Chapter 1.6 and to come back with comments on the Chapter 1.6 so that we can deal with any issues. Once this Chapter 1.6 is adopted, then we will be able to return to all the chapters for which WOAH grants a status to be able to streamline the differences between processes and conditions. So we have this ongoing, and I hope that the 27 member states of the EU will understand that for the moment we are dealing with what we have on our table, and that we are going to work on the Chapter 1.6 and eventually after also on all the chapters for which we have a status. So with this, I cannot change anything in this text.
Okay, thank you. Back to the delegates. Are there any other comments? Okay, so let's propose this standard for adoption. We have quorum. So first question, I ask if there are any objections. None. Are there any abstentions? Probably we need help to say the names. So I start by Austria, France, Finland, Italy, Latvia, Slovakia, Romania, Slovenia, Cyprus, Belgium, Greece. I guess from this side it's already now Portugal, Germany, Denmark, Spain, Estonia, Ireland, Malta, Norway, Poland, Czech Republic, Netherlands, Sweden, North Macedonia, Luxembourg, Lithuania, and Hungary.
Estonia and Croatia.
Croatia. Estonia, did I already mention? Can you help me count them? North Macedonia already mentioned.
Okay.
Moldova.
Where?
Moldova.
Moldova and Serbia. I guess it's the... We have 23. Perhaps we need to count them again. It's better to count them again.
Yeah, if you can.
Okay. Sorry, but it's for us to.
The countries that I have, and then those
Okay.
that are. So I will repeat the ones I have, and those that I have in name, please get up again. So I have Austria, France, Finland, Italy, Latvia, Slovakia, Romania, Slovenia, Cyprus, Belgium, Greece, Portugal, Germany, Spain, Estonia, Norway, Poland, North Macedonia, Ireland, Croatia, Moldavia, Serbia. So I'm still missing. Can you?
No, I will help. Denmark, Bosnia-Herzegovina, Hungary.
Wait, slow. Bosnia, Hungary.
Luxembourg, Lithuania, Netherlands, Sweden, Malta, and Czech Republic.
And San Marino.
And San Marino.
The extensions of which...
And probably it's better to say the names again.
Okay. So I have 33 members abstaining. So I will repeat them again. It's Austria, France, Finland, Italy, Latvia, Slovakia, Romania, Slovenia, Cyprus, Belgium, Greece, Portugal, Germany, Spain, Estonia, Norway, Poland, North Macedonia, Ireland, Croatia, Moldavia, Serbia, Denmark, Bosnia and Herzegovina, Hungary, Luxembourg, Lithuania, Netherlands, Sweden, Malta, San Marino, and Czech Republic.
Is there everybody that wants to abstain has the name in the list, correct? Okay, but if I'm if I'm not wrong, we still have conditions to confirm the adoption of the standard. Okay.
So before the adoption of the standard, just to make a comment that the Status Department is working together with the Code Secretariat to work with the members on trying to streamline the status recognition process. So we've been doing a lot of communication and efforts, and this will be covered also by Cristobal during the presentation. So we do look forward to the revision of Chapter 1.6. And meanwhile, there's this continuous work that is being done with the members for better understanding of what are the requirements for not only the status recognition, but also the status maintenance. We are hopeful that with this work, there will be a good understanding from the membership on this process that will allow for a better streamlining of the whole process. Thank you.
Please, Manuel.
Yes, I want to add something because we cannot not say anything when we have so many abstentions. So I think that we heard you, and that it's also a good time because, as you know, as I said, this year is the first 30th anniversary of the status process. So this question of how we maintain or reconfirm the status is very important. I hear some concerns. So indeed, as Montse said, and as Etienne said too, it will be very important to work on the chapter and maybe also have discussion about how we do and how we maybe could do better. Or I think it is the right moment after 30 years of having these very important tools that we have and which is very important for trade in particular, not only, but also for increasing the control of the disease and also for the recognition and for the trade. Thank you very much.
Thank you, Emmanuel. Taking into account the comments of our Deputy Director General and our Director General, we still need to conclude that the standard was adopted. So one more. Thank you so much. Adopted with 33 abstentions.
Thank you, Mrs. President. Just sorry, before breaking for lunch, we need to do the same exercise for CSF because it's exactly the same change. Just if it's possible to see if there is exactly the same or not, I don't know.
Okay, we need to launch, but yes, if we can check this one.
Maybe if the abstentions are going to be from the same members, only for the abstentions, those that, if there are additional ones, just to raise their hands so we can keep the 33 and then we don't need to go again.
Okay, but let's hear first, Etienne, if you want to add anything or we just propose for adoption.
I discussed this in the first part, so
okay.
Just to see if there is the same, but I think so. But
okay, so the standard is submitted to the adoption. And I'd like to see and ask first if there are any interventions. Cyprus.
Thank you, Madam Chair. I'm talking on behalf of the 27 member states of the EU. In line with the previous comments on the FMD chapter, the EU needs to reiterate the importance of ensuring that annual reconfirmation process remains proportionate and sustainable. We wish to clarify again that an annual declaration by the delegate and transparent notification obligations should be sufficient for the reconfirmation process, where the epidemiological situation and import rules and conditions remain unchanged. We refer to our written comments for further details. In light of these concerns, the EU needs to abstain today from the vote of the proposed changes to Article 3 and 5 of the CSF chapter in the Code. The EU understands that the EU concerns on the confirmation process are to be addressed as soon as possible by revising Chapter 1.6. Thank you.
Thank you, Cyprus. Any other comments? Okay, so let's propose this standard for adoption. And the question is if there are any objections. No objections. Are there any abstentions? Okay, so as Monse already mentioned, are the same members that already abstained in the first standard are the ones that want to abstain now again. Is that correct? But probably we need to check them.
So I would just need to check those that, if there are any additional ones from the last resolution, can you stand up?
Yeah, we need to count them. Yes, it's better. So
Okay.
we need to count.
So
we will do the procedure again.
Maybe I will rename the countries.
No.
No?
Let's say.
Okay.
Okay. Placards. It's better, to better clarification. Austria, please, it's better to write. Sorry, Monse. Austria, Cyprus, France, Finland, Belgium, Greece, Italy, Moldova, Serbia, Latvia, Romania, it's upside down, Slovakia, Slovenia, okay, Portugal, Germany, Croatia, Estonia, Spain, Ireland, Denmark, Bosnia, Hungary, Malta, Norway, Poland.
Wait. Malta, sorry.
Poland, Czech Republic, yeah, Netherlands, Lithuania, Sweden, Luxembourg, and North Macedonia. And San Marino. Maybe you read the names.
I will repeat again. Austria, Cyprus, France, Finland, Belgium, Greece, Italy, Portugal, Norway, Czech Republic, Moldavia, Serbia, Latvia, Romania, Slovakia, Slovenia, Portugal, Germany, Netherlands, Lithuania, Sweden, Luxembourg, Croatia, Estonia, Spain, Ireland, Denmark, Bosnia, Hungary, Malta, North Macedonia, and San Marino. Did I miss anybody? I cannot
Poland.
see. And Poland.
We are counting. The same 33. Any comments before conclusions from you? No? So we can confirm the adoption of this standard. With 33 abstentions. So it's time to break for lunch. We will suspend the meeting. And we will... No, it's better to stop. Now we will stop. And we come back here at 2:30, okay? Please be back sharply, and we need quorum. And I also ask that the members who made interventions provide them in written to the rapporteur's table. They are... Oh, sorry. We need to start at 2 o'clock, not 2:30, 2 o'clock. Yes, I mentioned quorum. Keep that in mind. Thank you.
Sorry? Yeah, I'm sitting here, but I think we need one more chair. Yeah. And then François Kaya will... Okay. One more chair. Mm-hmm. Yeah. On est 7. Okay, so if Francisco's not here, can you sit there? Mm-hmm. Then we've got Let's, François, and Ahmad here. Yes. François. Flora, je peux... Let's is not here. Nathalie.
Are we waiting for someone else?
Let's va venir or no? Okay. Okay. Okay.
Are you going to start like this, or are you going to enter and...
No, we start like this.
Okay.
Yeah, all seated.
Okay.
Okay.
Sure, do it.
Okay. Okay, your smartphone is Mentimeter ready. Now let's bring the energy back into the room. Let's begin our whistle-stop tour of the 5 WOAH regions. We're going to start with Asia and the Pacific. Dr. Tomoko Ishibashi will explore what it really takes to stay one step ahead of emerging threats. Dr. Ishibashi, the floor is now yours. Then you can.
We all know that early detection of disease outbreak is crucial for disease control. It is the starting point for countermeasures, which is why accurate, fast, and detailed information really matters. Please recall that our region stretches from
Put the microphone like on your chin, but not like this, like this. Comme ça.
Like this. If you can, just put like this microphone. Okay, it's better for some. Okay. Thank you.
Okay. Should I do that now until the end? Once. Okay. Please recall that our region stretches from Fiji in the east to Iran in the west, and from Mongolia in the north and to New Zealand in the south, making it one of the most diverse regions in terms of geography, climate, livestock farming practice, and social structure. Consequently, it is natural that there are significant differences in both the distribution of diseases and type of diseases that require specific responses from among members. And this also means that many are uneasy about unfamiliar diseases being introduced. Responding to these regional realities and supporting our members in addressing them is a key part of our role as a regional office. So what do we do to provide regional members with early warning and help strengthening reporting? WOAH has a long history with WAHs. Like other regions, we promote its use through close communication with members and through focal point training. But today, I'd like to highlight a few points beyond that. First is expanding the regional scope. Earlier this year, we conducted focal point training for disease reporting, which addressed the diverse need of our participants, ranging from non-WOAH members in the Pacific Islands to experienced WOAH focal points. The inclusion of non-WOAH members has strengthened the overall regional capacity of disease reporting through the WAHIS platform. Second is the initiative of active search of epidemic intelligence in our region. The initiative started in 2023 to enhance early detection of animal disease in our region, a pilot for WOAH. Thanks to the voluntary support provided by Australia for this pilot initiative, our team regularly reviews local news sources across the region, and when there are signs of possible outbreak, we react and reach out directly to the possibly affected members. And this has already led to increased reporting to WAHIS. Our goal is to analyze the barriers to disease notification and apply targeted solutions. In addition, the ASEAN Regional Animal Health Information System, ARAHIS, which both Bangkok and Tokyo office have supported, and the regional aquatic animal disease reporting, which the Tokyo office has been operated jointly with the network of aquaculture centers in Asia and the Pacific. Both have been integrated into WAHIS reporting system. This is meant to simplify reporting and provide timely information to regional members. In such a diverse region, strengthening timely reporting and transparency remains an ongoing priority because they are essential for building trust, enabling early action, and ensuring effective disease control.
Thank you very much, Dr. Ishibashi. What really resonated with me was that pilot project where you reach out to countries that are possibly affected by emerging diseases. Thank you. We're now going to continue our journey to the Europe region. Dr. Budimir Plavsic will speak to what it means to be ready before the crisis begins. Dr. Plavsic, the floor is now yours.
Thank you. Do you think I should read the whole thing now? I mean, or just to test how it is working, because I'm not comfortable to go through again.
First statement.
Yeah, so the voice, the microphone, I mean, to test, and then I will finish in this way.
Okay. Yeah, as long as tomorrow we can keep it under 4 minutes, it should be fine.
Absolutely. So
okay.
that is clear. I manage that. I know the timing. I'm perfectly aware. No worries about that.
Okay.
Yeah, and we will have timer here. So is voice okay? Should I go up?
They just said to put the microphone on your chin when you're speaking. Here. Yeah, directly on your chin.
On indeed.
Yeah, so the people in the room can hear you.
Okay, good.
Yeah.
Then should we watch each other or audience? What is the...
I think you can switch between looking at us and looking at the audience, whatever makes you feel more comfortable with the message you're trying to send.
Good. Excellent. Thanks. Mm-hmm.
Okay, so c'est bon? Oui, okay. So for the final stop of our world tour, we're going to head to the Middle East region. Dr. Ahmad Al-Majali will remind us why everything ultimately depends on systems we can truly trust. Dr. Al-Majali, the floor is now yours.
Well, thank you very much. I think what we are talking here about is quite important. And in a region where we are facing a lot of challenges, it is very important to strengthen veterinary services for effective disease control and for making animal health systems more reliable and trusted. Definitely mine will be under 4 minutes. So.
Okay.
So,
Okay.
but that's the way, like, you know. And we will have a timer here, right? Mine is very short. But
Okay. I'll be in charge of timekeeping myself. So if I feel like you're reaching the 4-minute mark, I can give you a little sign with a finger like this.
Maybe 1 minute.
Mm-hmm. Yeah, 60-second.
Should be
So
fine.
that means 1 minute, huh?
Yeah, so this is the statement, and then you will come back to us with more questions, right?
Yes.
Another question, which is to give an example or something like that, yeah.
So this, what we just rehearsed, is part 1, where each of you will speak for 4 minutes. Okay. We're going to go through the 5 regions. And then we're now going to, once you finish your intervention, Ahmad, we're going to go into part 2, where we have 2 questions that will be displayed on the big screen. And the audience members will be able to scan a QR code. Okay. They will answer the multiple choice question, and we'll see the results on the screen.
Yeah.
Yes.
Yeah. Okay.
And then I'll react to the results that we see on the screen. I'll say, like, you know, top choice is trust, next choice is coordination, and maybe the choice with the least amount of votes is standards implementation. And that's where we turn to the panelists to get your live reaction. And you can speak about your perspective from your own region.
Yes.
Mm-hmm.
Great. Perfect.
That will be 2 minutes, 3 minutes, the question to respond to the question.
I think for part 2, we definitely need to keep your intervention short. So I would say like 1 to 2,
okay.
1 minute if possible to react. Natalie, do you think 1 minute is suitable for reacting to the Mentimeter question? 2 minutes? 2 minutes. Okay. Okay.
And just one point,
Mm-hmm.
thank you for supporting us on this. I sent the script that there's opportunity for maybe floor questions.
Yes.
Yeah, exactly. I think that would be great to promote this. Like the mentee is good, but to have 2 questions from the audience.
But actually they are in yellow because our concern is that we don't know if we will have time. It will depend. That's why the idea today, and I understand that some of you want to prepare well the statement, but the idea today was you read the statement so that we make sure we are in 4 minutes, eventually even 3 minutes for the statements, because it will allow us to give more time to the audience, which is really...
Yeah, but for that we don't need to do it here. I think it's a matter of,
of course.
Each of us to practice and to fit in the time cut where it needs. So it's
3 to 4 minutes.
going towards
Dear colleagues, we are still waiting for quorum. 2 delegates more are needed in our plenary. Now we can start. So we have now lots of work to do in our agenda, so I hope that you enjoy the lunch period. And now I will give the floor again to Etienne to start the session that we interrupt for lunch period. Etienne, you have the floor.
Thank you very much, Mrs. President. I come back to the last annexes of our reports for adoption. Now we are dealing with the Annex 15 on the Chapter 820 on infection with Francisella tularensis, which is the tularemia. And as I said this morning, we modified this chapter first because there is a new Article 1 on general provision and the case definition, so we needed that. So we had to modify it in collaboration with the SCAD and the BSC. And some articles were harmonized a little bit in terms of language. However, this will continue, the work on this chapter will continue to include more on the status, on the recovery, on the trade, etc., on the surveillance. So that we have a complete chapter, but this would be done in the next step. So for this first step, Mrs. President, I hope the members will agree to adopt these 4 or 5 articles of this chapter.
Okay, so I hope the floor for interventions about this chapter. United States of America. And I'm happy to give you the floor.
Thank you, Madam President. The United States thanks the Commission for their work on Chapter 8.20, tularemia. Because it brings reference to the case definition, we propose amendment to Article 8.20.4. Specifically, we request addition of the word "the" before 15 days in point 3 of Article 8.20.4. Addition of "the" will clearly capture the intent that the animal quarantine period, when no clinical signs of disease were observed, occurred just prior to shipment. Without this modifier, it would be possible to interpret that any 15-day quarantine time period, even if separated by days, months, or longer from the actual date of shipment, could meet import requirements. Improperly quarantined animals could spread disease and compromise safe international trade. Thank you.
Thank you, United States. Any other comments? No? Back to you, Etienne.
Thank you, thank you. So if I understand well, is the last point of this chapter at the end of Article 824, new number 4, for the importation of hares. And there is point 4 that says that they were kept in a quarantine center for at least 15 days prior to shipment. And during this period, the animals showed no clinical signs of infection with Francisella tularensis. I see where you want to put the is between at least and 15 days. Now I understand the English issue. We use normally this language in other chapters, but maybe not with a full consistency. So if everybody is okay, maybe we can add this "the." I understand that it's clearer that we mean these very 15 days between -15 to 0, the last day. And then we will have to look at this point in other chapters to see and to be consistent in the rest. So we will change our work program a little bit.
It's clear, I guess. Comments from your side? Okay, we have quorum. we can move on. So I present this standard for adoption with these amendments. And so I ask if there are any objections from the delegations, from the delegates. No objections. I want to say if there are any abstentions. No, so standard is approved by consensus. Tian?
Thank you. So we continue with another chapter for the changes meant to introduce this time, not to modify, but to introduce the case definition and general provisions. So it's the chapter 8X for the moment, a new chapter on infection with Congo hemorrhagic fever virus. It was circulated 4 times. This is a single article. Maybe in the future we will continue this chapter, but for the moment there is not enough data to propose a full chapter. So we propose this single article chapter for adoption until we have further data to continue the work on this disease. Oh, sorry, and of course we're waiting for your comments.
Okay, floor is open. Senegal. Please, you have the floor.
Merci, Madame la Présidente. Donc,
Thank you, Madam Chairperson. Senegal would like to speak on behalf of all 54 member countries of the African Union. Africa commends the Commission for the elaboration of this new chapter on infection with the Crimean Congo hemorrhagic fever virus. And for the it is a need to protect animal health and human health against this emerging zoonosis with a vectorial transmission. Africa considers the definition of cases as proposed in the absence of clinical signs in the animal, and the use of laboratory diagnostics to isolate the virus with molecular biology and serology. And Africa is therefore in favor of adding this important chapter. However, considering the background of climate change, we encourage WOAH to take preventions to prevent the infection with the Crimean Congo hemorrhagic fever virus. Thank you, Madam Chairperson.
Etienne, back to you.
Oui, juste pour remercier la
I would like to thank the African representative. It is written in the chapter. The point of this chapter is mostly, essentially, to work on public health, because it is early warning that will help us to implement awareness campaigns to avoid any transmission to humans and any human cases. So yes, we are in agreement.
With that clarification, are there any other comments? So I propose the standard for adoption. Are there any objections? No. Any abstentions? No. So standard approved by consensus. Back to you.
Thank you very much. Last annex on a new chapter for birds is chapter 10X, infection with avian metapneumovirus. The same, it was a listed disease, but there was no chapter, there was no case definition. So there is one article, at least for case definition, and this has been drafted so that the members can abide with their obligation for notification of this disease. And it was done in collaboration again with the Scientific Commission and the Biological Standard Commission.
Okay, thanks, Etienne. I open the floor for comments. Korea.
Thank you, for Madam Chair. The Republic of Korea is pleased to support the adaptation of a new chapter on avian metapneumovirus infection, and we would like to extend our gratitude to the Code Commission for its dedicated effort in developing this chapter. In particular, couriers appreciate that our scientific proposal have been reflected in this text. Specifically, that the definition of occurrence of infection should be limited to unvaccinated poultry to account for the issue of zero conversion. Thank you.
Thank you, Korea. Any other comments? No, Etienne, back to you.
No comment. It's good that we have good comments and a good scientific basis so that we can adapt the drafts.
Yes, very positive one. Thank you, Korea. So we propose the standard for adoption. Are there any objections? No. Any abstentions? Okay, standard is approved by consensus. Back to you.
Okay, so now we go back to the beginning of the annexes, and we have an annex on the glossary, Annex 5 of the report. And you will see there are a lot of definitions that are proposed for this year, because some of the definitions are linked with the chapter you have just adopted, the chapter on biosecurity and the chapters on import and export procedures. So disinfection, isolation, pathogenic agent are linked with biosecurity. Point of entry, point of exit are linked with the trade, the import-export. The same with approved biosecurity, biosecurity plant, etc. All these terms either were new, like the one we have there, or have been revised to include the change that we did in the chapters. And so all of these are a consequence of the adoption of the chapters, of the specific horizontal chapters. So there, again, we have a lot of discussion and preparation work with the SCAD and the BSC, especially when we talk about biosecurity, but also when you talk about laboratory or quarantine center with the SCAD, etc. So we have different types of circulation because it was not completely in parallel. But with this, I think it's the comment we received were positive, so we propose that as an adoption in parallel to the adoption that we had this morning.
Any interventions? No. We can continue. And proposed for adoption, the glossary. So are there any objections? Sorry? Objections? No. Abstentions? No. So the glossary is also approved by consensus. Last one.
Thank you. And the last annex for today is the Annex 6. On some articles of the chapter 1.3 on the disease lists, so the list of disease, sorry. And so, again, we do that at the end because for 3 of them, it's a change of name. For Turkey rhinotracheitis, for Crimea Congo hemorrhagic fever, and for tularemia, it's a new name. And for Nairobi sheep disease, which was assessed, and it was assessed last year by the SCAD, and we discussed with them, and we proposed to delete Nairobi sheep disease from the list because it doesn't meet the criteria for listing. It doesn't mean that this disease is not important for some countries, but it's not important enough at global level to be listed and notifiable by all members. So I propose for adoption this new revised list with the changes in Article 1, 3, and 7.
Okay, open the floor for interventions. There aren't any interventions, so we propose for adoption this chapter. So are there any objections? No? Any abstentions? So I confirm the adoption by consensus.
Thank you very much. If I may, just one last word. I'd like just to come back to what I said earlier about the standards not being compulsory, I would not shoot in my own foot or in our own foot by saying we should not follow the WOAH standards. Of course, we should all follow the WOAH standards. They are adopted for them to be followed, to be implemented. But again, these are not rules. These are standards for the members to be able to build their own regulation. So it's not supposed to be black and white, a regulation, but it's the basis for everybody to work on the same language, have the same harmonized view on some specific topics or some specific disease, so that when we talk about those issues, we talk the same way. And we understand that for some countries, it might be complicated to implement and to revise and to create new law or new regulations based on these standards. But that's up to the countries to have a good relationships, and WOAH is also helping a lot to put forward some training and capacity building for the members to be able to advance in that direction. So, no, it's really we should follow the standards. Thank you very much.
It's clear, Etienne. Yes, Manuel, please.
Just wanted to add that also we should not forget that they are recognized by World Trade Organization. Thank you.
Oui. Qui existe encore.
Thank you, Etienne, and thank you. It was a very successful session. Thank you so much. All the standards were adopted, so thank you to you and to your team. And now I have the pleasure to invite the chair of the Scientific Commission for Animal Diseases to present the activities of the Commission. So, if you can please come here to the stage. So, Cristobal Zepeda, you have the floor.
It's working? Can you hear me? Thank you very much, Madam President, Susana Pombo, the Director General, Emmanuel Suberan, Montse Arroyo, the DDG for WOAH. I'd like to present a summary of the work of the Scientific Commission for the past year from May 2025 until today. I don't have the control. All right. Thank you. First and foremost, I want to thank the members of the Commission for their knowledge, their time, their dedication. As the President of the Code Commission mentioned during his presentation, the work of the commissions is not only during our biannual meetings in February and September, but it goes on throughout the year. In particular, for the Scientific Commission, our members participate in all ad hoc groups under the mandate of the Commission, and we also are very active electronically with status recognitions, either countries that get an outbreak and get suspended, fast-track reinstatements, all sorts of information that we need to review electronically in between sessions. And as always, I'd like to thank the Secretariat that supports the Scientific Commission, because without them, we really would not be able to perform our work. They are essential for the functioning of the Scientific Commission, so thank you very much, every one of you. So I'd like to present, as I said, a summary of the activities of the Scientific Commission for this past year. And it was a particularly busy year. We had, as usual, 2 Commission meetings in September and February. We provided support to 10 ad hoc group meetings, as well as the working group on wildlife. We liaised with the Code Commission, and we had a bureau meeting in February, and contributed with the Code Commission to 7 different code chapters. We are continuing to work on the official status activities, and we reviewed 23 new applications and 3 applications for fast-track assessment. We continued to work on case definitions and provided 3 new case definitions that were endorsed. We also provided a definition for influenza A viruses of high pathogenicity in poultry, in cattle, and is now an emerging disease that needs to be notified as such to the World Organization for Animal Health. And in addition, we are providing support to the global eradication programs, and we provided comments and support to the guidelines on FMD surveillance and African swine fever vaccines. As I mentioned, we provided technical support to several ad hoc groups, and what this means is that a member of the Commission actually sits in these groups and provides orientation and guidance. We had a group, ad hoc group on zoning, in which I had the pleasure to participate, and then the several ad hoc groups for status, for foot and mouth disease, for dog-mediated rabies, which is endorsement of official control programs, African swine fever, BSC, PPR, classical swine fever, and of course, continued engagement with the wildlife working group. So we provided support to different chapters. In September and February, we worked on Chapter 1.6 on procedures for official recognition of the animal health status, and on the chapter of classical swine fever. And during our February meeting, we worked on several chapters, including foot and mouth disease, lumpy skin disease, Venezuelan equine encephalomyelitis, and PPR. One of the tasks of the Commission, and it is something that we want to increase our involvement in, are the global control and eradication strategies and other WOAH initiatives. So as you know, we have several global control and eradication strategies, and I'm going to provide some highlights on each of them. For foot and mouth disease, WOAH organized workshops on the procedures and requirements for official status recognition and endorsement of official control programs in South Africa in July of last year. SCAD, through the Status Department, continually provides support to members that have had their official status suspended due to outbreaks, and we help them to try to regain and reinstate their status. There's a new roadmap for the Southeastern Asia Control for Foot and Mouth Disease program for 2026 and through 2030. And this is a recurring theme. We are now reviewing a lot of the strategies in terms of their time horizon. And as you will see for PPR and others, there are new revisions of the strategy. In the case of the foot and mouth global control strategy, the current strategy was launched in 2012 in Bangkok with a span of 15 years, which lapses in 2027, next year. The main 3 components of the global FMD control strategy is, of course, to improve global FMD control, but also to strengthen the veterinary services in the respective countries, and through that also contribute to improving the prevention of other major diseases of livestock. The revision has started by the GFTAD's FMD working group, and the aim is to launch the revised strategy on the 3rd quarter of 2027. For PPR, there's a review of the goal of global eradication by 2030. We are just 4 years away from that, and there hasn't been the progress we expected, and so the time frame needs to be reviewed. There's the PPR monitoring and assessment tool, the PMET, has now been translated into French and Russian and will be released shortly, as well as electronic learning modules that also will be launched shortly. We continue to see significant activity by the PPR Pan-African Eradication Program, implemented by the African Union and their partner organizations. And through the global strategy, we have global and regional meetings to review progress and define future priorities. For avian influenza, again, the strategy was reviewed and published last year with a span of 10 years from 2024 to 2033. The strategy was presented and followed up at global regional meetings and webinars for awareness and implementation. The idea now is to frame the control strategy on a One Health approach to for sustainable poultry sector transformation, aiming to prevent outbreaks, protect livelihoods, safeguard biodiversity, and reduce public health risks. The strategy also provides a framework for countries to update their national control plans. And of course, we'd like to thank always the GFTAD's HPAI working group that helps coordinate and provide strategic guidance for implementation. With rabies, we continue with the objective of 0 human deaths due to dog-mediated rabies by 2030, hence the motto 0 by 30. And we continue to see strong coordination between stakeholders, and including the United Alliance Against Rabies that has now over 90 partners representing 38 countries. We have a robust laboratory network, RabLab, that has 14 laboratories worldwide. There was a partnership map published so we can identify where the different instances and collaborators are located. And there was an annual stakeholder meeting held in Bangkok in 2025 to assess the progress and define the priorities onward. We continue to monitor the progress made towards 0 by 30, and we have a monitoring and evaluation framework available, as well as a library of national strategic plans for rabies. Of course, raising awareness is essential in a program like this one, and we have several tools that we use, such as the Rabies Today podcast, webinars, newsletters, and an expanded library of courses and trainings. Through the network, we're offering new guidance on the use of lateral flow devices for field applications, and also there is a repository on human-to-dog ratio and dog population estimates. For African swine fever, again, there is an update on the Global Initiative for African Swine Fever with a time horizon of 2026 to 2030 that was published just now in May. And this document sets the goals for this new five-period term. Under the GFTADs, the ASF working group continues to coordinate and provide strategic guidance for the implementation of the strategy. We have now a standing group of experts in all regions to share knowledge, exchange, and coordination. And on the sidelines of this general session, there was the 4th Global Coordination Committee at the margins of the session. And we also provide a regular situation update and webinars for all participants. We move now to one of the pillars of the work of the Scientific Commission, which is the official animal health status recognition and endorsement of official control programs. This year, we are proposing and recommending for adoption 6 zones in Brazil where vaccination is not practiced. I just want to remind the membership that Brazil has already achieved freedom without vaccination for the entirety of the country, and this is just a strategic alignment of their zones to suit their needs. But Brazil was already free without vaccination. Colombia is now adding a disease-free zone in dark blue on the right, zone where vaccination is not practiced, and also the islands of Amazonas, Vaupés, and municipality of Miraflores in Guaviare, sorry. Kazakhstan is adding one zone where vaccination is practiced. It's the zone 6 in yellow, adding to the other zones that were already existing in Kazakhstan. Turkey is adding the island of Gökçeada, and forgive me if I mispronounced it. I did Google it, but I had a hard time pronouncing the name, as a zone free from FMD where vaccination is practiced. Now, moving on to the endorsement of control programs for dog-mediated rabies, we are proposing endorsement of Malawi, Saudi Arabia, Zimbabwe, and Zimbabwe. For PPR, we are proposing for a recommendation as a free country, Sri Lanka. And for classical swine fever, Bolivia is proposing the Department of Santa Cruz as free of classical swine fever. For Colombia, again with classical swine fever, it's the 2 islands in the archipelago of San Andres, Providencia, and Santa Catalina that are being added to the free zone in Colombia. One thing that I'd like to spend a little bit of time in each general session is to raise your attention on the deadlines for status evaluation. The dates are for the different ad hoc groups that will assess new dossiers are there, but really the date that is important for members is the date in brackets. So for BSc, all submissions need to be in by July 29, for dog-mediated rabies by August 7, PPR August 21st, CSF September 18, foot-and-mouth disease 14 of August, and September 10 for African swine fever and contagious bovine pleuropneumonia. Good. One huge component of the work of the Status Department and SCAD in particular during our February meeting is the annual reconfirmations of the official animal health status and endorsed official control programs. A total of 391 annual reconfirmations were assessed. Of these, between the Status Department and the Scientific Commission, we select those that have potential to have conflicting information or countries that we might need to require additional information from, and we comprehensively reviewed 49 of these annual reconfirmations. The list of members that is proposed for retention on the list was communicated to all WOAH delegates on 11 March of 2026. I just want also to touch on an issue that we've been hearing for the past few years, and we heard again this morning, and it's the issue of the burden that the annual reconfirmation process is placing on some countries. We have heard those concerns. Member countries have raised those concerns not only this general session, but for the past 2 or 3. And we are committed to streamline the procedure, make it more nimble, easier for all member countries. And as such, we have revised the annual foot-and-mouth disease reconfirmation form, and now it is much simpler, and we're starting a pilot phase with members. And I invite all interested members to either write to the Status Department or go by the kiosk to express your interest before the end of May, because we want to launch this annual reconfirmation, streamlined annual reconfirmation procedure very soon. And so I hope to get your positive and constructive feedback on the streamlined procedure, maybe review the types of questions and data that is being required, so we can try to mimic, once we have a good model for foot and mouth disease, replicate this for the other official status diseases. One issue that has been popping up also in the past couple of years is that we are detecting countries that have an official status that either are not following the code recommendations for specific commodities and use alternative risk mitigation measures that are different from the code. Other countries are trading with countries that do not have a WOAH recognized status, but might be free. And other countries yet are trading from countries that have active cases of the disease, but they are recognizing either zones or compartments within those countries. Reminder that members with an official status have the responsibility to fully comply with the terrestrial code, and if they are not following the code to the letter, they can demonstrate equivalence in line with chapters 2.1 and 5.3. And a few years ago, we decided that we would give these countries a 5-year time period to document why they're not following the code and what they're doing instead. The idea here is that the countries need to show that if they're applying alternative risk mitigation measures, these should provide an equivalent level of risk as the provisions of the terrestrial code. And in the case of trading from countries that do not have an official status or zones within countries that are having active outbreaks, the countries need to show that the risk of introduction of the disease is equivalent to the risk posed by imports from countries having a disease-free status that is officially recognized by WOAH. And we've been developing a method to assess this equivalency, and will be annexed in our September 2026 report. We turn now to disease control specific issues, and we worked this year on the infections of bovines with influenza A viruses that are of high pathogenicity in poultry. And we continue to place very close attention to the situation of HPAI in dairy cows. I know Billy Carish and Etienne don't like us calling it HPAI, but it flows better, it's easier. But it is influenza A viruses in other species, right? In March 2025, WOAH published a case definition that was developed by the Scientific Commission for notification of HPAI in cattle as an emerging disease in accordance with the Terrestrial Code Chapter Article 114. So now members need to report avian influenza A viruses in cattle as an emerging disease. And WOAH updated a statement that was published in October 2025 about the infection in cattle. We also supported the development of guidelines for surveillance of highly pathogenic avian influenza in smallholder poultry systems. These guidelines were published in January of this year, and the guidelines offer practical recommendation in designing surveillance for HPAI in this type of setting, which is different than a commercial large-scale setting. In February 2026, there was a global webinar hosted to launch the guidelines to the delegates and other stakeholders. The next guidelines that we hope to have fairly soon is guidelines for surveillance in vaccinated populations. As we know, and we've heard repeatedly during this general session as well as last, there are some countries that have already started using vaccination in particular species, or in particular production systems, and we need to adapt and think about how to conduct surveillance in those environments. Good. We also have two different guidelines for African swine fever to mitigate disease transmission and risk at the wildlife-livestock interface to facilitate safe trade, and guidelines on African swine fever vaccines, including field evaluation and post-vaccination monitored. These are yet to be published. As Etienne mentioned during his presentation, every year we have a bureau meeting with the Code Commission, and we also work with the Biological Standards Commission, in particular with the development of case definitions. So with the Terrestrial Animal Health Code Commission, we met in February, addressed several topics that are listed there, including the revision of code chapters, disease assessment, the case definitions, etc., and also planning of new work. The idea is that we are working in unison with the same, or broadly the same work programs and same priorities, so that the work that we accomplish together makes for a more efficient and streamlined process in updating and developing new standards. As such, we worked with, with the Code Commission, the work program, and us, we are reviewing chapters 1.6, as I mentioned earlier, which are the procedures for official recognition, PPR, classical swine fever, zoning and compartmentalization, as well as Japanese encephalitis and VEE. Also, we are working on lumpy skin disease and sheep and goat pox. With the Biological Standards Commission, we don't have the same advantage that we have with the Code Commission, that we meet concurrently, but with the Biological Standards Commission, we meet at different times, but yet we are able to work together, especially on the development of new case definitions for inclusion on the code or the website, depending. What is our plan for next year? We will continue to work on WOAH standards, on zoning and compartmentalization. There's a meeting on zoning in October of this year. We'll continue to work on foot-and-mouth disease, Japanese encephalitis and West Nile virus, turkey rhinotracheitis, lumpy skin disease, VEE, PPR, sheep and goat pox, scrapie, and classical swine fever. So there's quite a number of WOAH standards that we will be working on. In terms of disease control issues, we continue to support the global strategies, guidelines of different kinds, such as the African swine fever ones that I mentioned, evaluation of emerging diseases, evaluation of pathogenic agents against the listing criteria, either to retain them on the list, drop them from the list, or adding them to the list. And of course, we'll continue to develop case definitions for those diseases that we've identified jointly with the Biological Standards Commission and the Code Commission. And finally, we'll continue to work on the evaluation of members' applications for official recognition and recovery of status, annual reconfirmation, including the streamlining of these procedures, and the assessment of equivalent of measures to demonstrate compliance and maintenance of status. As part of the reconfirmation process, we have also sent and created expert missions that go to the member countries to provide recommendations and identify areas that can be strengthened. If you're interested in accessing the full work program of the Commission, of course you can scan the QR code and also go directly to the website. And I also would like to encourage you to read the full reports of the Code Commission, the Code Commission too, but of the Scientific Commission, both for September and February meetings. Now, we have resolutions for adoption, and these relate, before that, I'd like to remind members how the process of the resolutions for recognizing disease freedom work. So the list of members recommended for official recognition is sent to all delegates 60 days prior to the general session, which happened on March 11. Within those 60 days, members may have objections or have additional questions to the member country, and the questions should be submitted in writing to the member country, but including the status department for awareness. Now, within 10 days of receiving the request for additional information, the member concerned should provide clarification on whole or part of the dossier upon request. And then SCAD considers all objections and comments received before proposing the draft resolutions for adoption by the Assembly. I'd like to note that this year there were no objections or requests for additional information received. So the official status or an endorsement of control programs resolutions are resolutions 19 through 27. You voted on all of these electronically except for resolution 19 that will be presented for adoption today, which is the resolution related to foot and mouth disease status. And the reason being is that we were still engaging with certain member countries until a week prior to the general session, and that's why that resolution could not be presented for electronic vote as we usually do. And with that, I thank you for your attention.
Thank you so much for your clear presentation, Cristobal. So I open the floor for hear your interventions, if any. Okay. It was very, very clear. No, we have Cyprus.
Speaking on behalf of the 27 members of the EU, the EU congratulates the Scientific Commission for Animal Diseases for its work over the past year. As WOAH marks 30 years of official status recognition, this anniversary is an opportunity to reflect on the strengths of the current system and how to make it more useful and efficient. Therefore, the EU invites the Assembly to engage in a fundamental discussion on the future of this system. WOAH official status has played a key role in eradicating rinderpest and remains essential for the global eradication programs for PPR and FMD. While it also supports WTO members under the SPS agreement, its potential is not fully used or respected by all trading partners. EU welcomes the ongoing revision of Code Chapter 1.6 by the Code Commission and SCAD. This is a chance to streamline and simplify procedures, especially for maintaining official status, an issue we have long highlighted. We also encourage centralizing all official status procedures in one horizontal chapter, rather than repeating them in disease-specific chapters, which has proven inefficient. We hope for our comments to be considered to make the system more efficient, flexible, and less burdensome for members, SCAD, and the Secretariat, and ultimately more attractive and widely used. More broadly, we also propose reflecting on criteria for official status recognition. A key element would be establishing objective criteria to determine for which diseases WOAH should grant official status. While such criteria exist for listing or delisting diseases in the code, they do not exist for deciding when official status is appropriate. Official status is clearly needed for diseases with global eradication programs, but its value is less evident for others with limited trade benefits. Granting status where it brings little use risks undermining the entire concept. The EU looks forward in engaging with WOAH and its members in this important discussion. Thank you very much.
Thank you, Cyprus. Any other comments? No? Cristobal, back to you if you want to answer.
Yes. Thank you for the comment on behalf of the European Union. And you made a point that is indeed a point that was delicate a few years ago, and that was the lack or difficulty and recognition and use of this freedom recognition by member countries. And that is why we've worked for the past 15 years or more in strengthening the process and improving the credibility of the process. And by virtue of which, we also made the process for annual reconfirmation more thorough to increase that credibility. Now, we're at a point where several member countries feel it's too onerous. So maybe it is time, at the 30th anniversary of the status recognition, to review how we're doing things. But the objective was not to place a burden on countries, but to increase the credibility of the process. Now, it is interesting that we do have criteria for listing diseases, for delisting diseases, but there are no real criteria to have diseases for which we grant official status. And I fully agree with you that all the diseases that are under the global eradication strategy should have an official disease status because, as you said, this helped us eradicate rinderpest, and it will help us control and eradicate PPR, foot and mouth disease, and other diseases. It would be interesting if WOAH could consider having a group of experts try to sit down and decide, well, what are the criteria to decide if a disease should be an official status disease or not. And if the diseases that we currently grant status for are all still pertinent. And I thank you for that comment.
Thank you so much for your clear answer. Any other comments? No? Nothing. Okay, so we can proceed, and I really would like to ask you to invite you to present resolution number 19, recognition of the foot and mouth disease status of members.
I'm not sure I have it there, but now how do I go back here? They already switched the presentation to the aquatics.
Yeah, okay, so, okay. We can move on. We have, as already our colleague mentioned, this resolution to adopt. So I would like to ask if there are any objections. No? So are there any abstentions? No, so okay, I confirm the adoption of this resolution by consensus from the Assembly. Thank you. Thank you so much for your work and the work of the whole team. It's always a pleasure to hear you. Thank you so much.
Very much, Susan.
Yes.
Yes, I think that, as I already said this morning, but it's better to say it again, because we hear some interesting discussion and question about the status, reconfirmation, for which disease we need status, and I really believe, and as it was asked by the president of the Scientific Commission for Animal Disease, that indeed this topic must be discussed the following month. As you have seen, there are already some discussion and some concrete work that has been done by the Status Department. to streamline the process, a pilot, and all countries, all members interested can apply for being part of this pilot. So, but anyway, we need to have a global discussion with people from representatives from different regions, maybe a group of experts, as it was proposed. So, indeed, we will work on it.
Thank you so much. It's in fact a very good answer from our organization. So we will proceed now with the Aquatic Animal Health Standards Commission, and I have the pleasure to invite Dr. Alicia Gallardo to present the standards proposed for adoption.
Muy buenas tardes, señora Presidenta.
Well, good afternoon, Mrs. Chair.
Own language, Spanish. So, your translator equipment. Thank you
very much, Mrs. Chair. And I'd like to thank the Director General. It is a real pleasure for me to invite you to the session of Aquatic Animal Health Standards Commission. I have the great pleasure to present the report of our Commission. So let me start with a brief introduction. I know it's late, but anyway, we will, navigate through the aquatic world, and we will review the text to be proposed for adoption in the code and in the manual, and I will talk about the other aspects of the work plan. First of all, I would like to thank the members of our commission. It's very, very strenuous, hard work. We worked over many, many hours, and we worked in a very focused manner. We worked on several topics. So I'd like to thank all the employers, the people in my team for their dedication. So I am with Saraya from Norway. She's sitting in the assembly. And I'd like to thank Fiona, who's the vice president, and Ingo, Kevin, and unfortunately Hong. They are not with us today, but they can watch us live on the streamline. But the Director General, as you can see on the picture, at the latest meeting, she spent a lot of time with us to talk about aquatic animals. So thanks a lot, Mrs. Director General. So let's start. Unlike the terrestrial code, as a commission, we are responsible to present the results and the standards on the basis of a scientific evidence. So this is the Aquatic Animal Health Code and Manual of Diagnostic Tests for Aquatic Animals. The code includes general rules that are very similar to the terrestrial codes, but there are specific chapters for fishes, molluscan, amphibians, and crustacean. For the moment, we don't have aquatic mammals that are affected by rabies. I guess it's a challenge, but anyway, it's a real pleasure to see our dear aquatic animals. So thank you for having presented them. So the manual includes all scientific progress that's been made for every single disease, and it also includes case definitions for allegedly healthy animals and clinically sick animals. So it's very interesting, and this work is performed by the two commissions, and we're interested in the updates of the case definitions. So what have we done since the last time, since the last general session? Well, we met several times through video conferencing systems, and with like to thank the reference centers at WOAH, collaborative centers and reference laboratories, because thanks to them, we were able to hold these meetings electronically, and we were able to address specific topics. We met Dr. Aaron from the United States and all the respective members, and together we talked about Chien-Divie, which is a listed disease for crustacean, as well as Dr. Isabel Lazus from the reference lab of mollusks in the EU. And this kind of meeting allows us to progress more quickly in a more efficient manner during our meetings. At the moment, we have two working groups. There's an active group that's been working on the preparation of the chapter of the manual to infection with megalocytovirus Pagrus 1. And this working group is creating an inter-laboratory system. Its method may be validated before it is included in the manual. And we also took part in the update of chapter 6.2 with regard to the prudent use of antimicrobials. And this work was done with the AMI group. And we were also participated in this, and we made a decision as a commission following this. So we worked hand in hand with the terrestrial codes. Of course, it's different diseases we're talking about, but I mean, we want to be fully aligned. I mean, especially when we deal with a general points. So then Saraya attended the zoning forum. And we also attended several events that I will mention later. We also attended many regional events on aquatic diseases, and we did enjoy it very much. We traveled all the way to India. We attended the aquatic disease Congress in Latin America, parts of Asia. So as a result, we were able to advocate our standards before various countries. And the main goal was to disseminate everything that we've learned in disease surveillance, and this includes chapter 1.4, and we also attended various webinars and various regional events, as I previously said. Along with the Commission on the Terrestrial Code, well, together we've been working hand in hand for the chapter on the introduction of Section 5 for certification in trade. This is a key chapter in order to introduce these various points in an educational manner and a very clear manner, among other chapters. We've also worked on the certification chapter. We attended the electronic certification group along with the terrestrial code.
Modificación del capítulo 1.
Together we worked to change chapter 1.1, notification of diseases. We discussed this during the whole time, and this includes the certification of emerging diseases, as we have mentioned it over the last few days. Now, it is very important to consider the contribution of the many groups, and we would like to underline the participation of other ad hoc groups, such as the ones assessing susceptibility of crustacean species to infection with a number of diseases and the diseases described by the code. For instance, we have a group assessing susceptibility of a crustacean species, fishes and amphibians. It has not been activated yet, but we have the participation in some chapters, especially the chapter on infection with Aphanomyces astacei, the crayfish, so-called crayfish plague, which is currently updating the species which are susceptible. And we also reviewed the chapter 6.2 with the ad hoc group for also the megalocytovirus Pagrus 1. We have been working on this listing for more than 1 year, and there will be some new news being shared during the September meeting. With regard to the reports we heard yesterday on WAHs, we heard that for aquatic animal diseases, there are in total 31 diseases, 2024, 2025, 2026. We notified 25 of those. So we have a challenge for notification. As the Madagascar delegate said, it is in all likelihood due to linked with better training and better notification of surveillance, but also because we need to share important information in such a way that we can alert or detect the disease in due time. We have chapter 1.1.5, article 1.1.5, for diseases which are considered as emerging diseases. And there was 1 year during which 2 diseases were no longer listed. These 2 diseases impacted prawns. So we see that we have to do the necessary, take necessary steps for notification. I'm going to tell you about positive news because we're very happy to see that sometimes the system works. There is a reference center from FAO, the Yellow Sea Fishery Institute, from the Chinese Academy of Science. They informed us during the month of March of an emerging disease in humans that would apparently be associated with a disease that affects aquatic animals. And this is infection with covert mortality nodovirus, so-called CMNV. Same disease that we had listed as an emerging disease, except we no longer list it as an emerging disease because there were no more cases. What I mean by that is that the system works, and this shows it. This information, this scientific publication has been shared by the experts from the reference center, and we're going to assess the criteria according to which we will trace and follow emerging diseases being listed. We need to, we want the various institutions to trust each other because this is the way we're going to achieve the One Health approach.
Vamos entonces a pasar, ustedes me dicen cuando, para los textos.
We're now going to move to the documents that we're suggesting, proposing for adoption. For the code, there are 6 annexes. Glossary, one definition that was not ultimated during the last general session. We're talking about updating the chapter on sanitary rest. There is the update on a specific chapter, infection with Aphanomyces astacei. I've already mentioned it, the crayfish plague. We're talking about updating the species. A specific chapter in which we explain the second way for self-declaration, and finally, an update on the current taxonomy. I'm going to move on to the various annexes so that you can provide comments. Last year, we approved the chapter regarding movement control for ornamental aquatic animals, 5. Annex 5, Chapter 512. But we were never really able to define what an aquatic animal was here. And so last year, we made a change. We submitted it to the approval, and we wanted this to be clearer to understand. So an ornamental aquatic animal is an animal traded to be exhibited and traded as pet and used for shows. And we added the word distributed or traded, which is something that we had not mentioned so far. So that's an additional explanation which will be integrated in the code when the animal is distributed as a pet. Madam President, you have, I will give back the floor to you.
Considering the specific situation of the glossary, I see no one requesting the floor, so I guess we can proceed. So we proposed this Annex 5 for adoption, and we have quorum, so I ask if there are any objections. No. Any abstentions? No. So I confirm the adoption by consensus.
Thank you. Thank you, Madam President. Vamos a pasar a el segundo.
Thank you, Madam Chairperson. We are going to move on to the next annex, Chapter 4.7, Following in Aquaculture. This chapter was adopted following the previous two chapters which were approved last year regarding management of disease outbreaks, emergency disease preparedness. And we agreed to say that the article for following would be used so that we would have a complete chapter that also takes in consideration the chapters on outbreaks and emergencies. We therefore adopted the chapter. We received many comments. We circulated the chapter, sorry. We received many comments. We defined two types of following, voluntary and compulsory, the second being associated with a disease control program. And we therefore have a better results with the chapter, which means that we have improved the chapter. It is clearer and written in a more efficient way. Are there any requests for intervention?
Give you the floor, please.
Thank you, Madam President. The United States does not support adoption of the proposed changes in Annex 6 regarding fallowing and aquaculture without modifications to the proposed text. We feel the proposed wording in Article 4.7.2 incorrectly suggests, in the case of an open aquaculture establishment, such as a net pen in a lake, that all the aquatic animals in the lake would need to be removed. This is impractical, and we do not believe was the original intent. We therefore propose inserting reference to Article 4.7.5. The text would therefore read, "The fallowing period cannot commence until all aquatic animals have been removed as described in point 1 of Article 4.7.5, and the aquaculture establishment has been thoroughly cleaned and disinfected." We believe this revised wording supports the original intent while clarifying that the susceptible species and vector species should be removed from the aquaculture establishment prior to commencing the cleaning, disinfection, and subsequent fallowing. Thank you.
Thank you. Please, you can
Muchas
comment.
gracias, Presidenta. Muchas gracias, Estados Unidos, por la...
Thank you, United States, for this explanation.
¿Puedes pasar la siguiente? Me sale con eco. Bueno, les quiero decir que muchas.
I wanted to say so. Thank you very much to the United States for this explanation, because by adding to Article 4.7.2 that the following period can only start when all the aquatic animals have been removed, as described in 4.1, Article 4.7.5, which precisely describes which animals are included in the agriculture center. So this new formulation is actually much better because we more specifically refer to what is described in Article 4.7.5. And therefore, based on the recommendation we have just received as the Commission, we recommend to adopt Annex 6 following the United States comments and as it is currently written on the screen.
Merci, Madame la Présidente.
Thank you, Madam Chairperson. I will take the floor on behalf of the 54 member states of the African Union, which are all UNSA members, WOAH members. Africa is in favor of adoption of the chapter on the health of aquatic animals such that we just examined. But Africa would also like to draw your attention to a new proposal, working proposal, with regard to the 2025-2027 working program for the Sanitary Code Standards Commission for Aquatic Animals with regard to vaccinations for aquatic animals. The specific request is the following. WOAH should create an ad hoc group for vaccinations of aquatic animals in order to assess the absence review the absence of standards regarding the protection, the quality control, the trials and the registration, the distribution, and the use, safe use, and in order to recommend the most appropriate pathway. This could include a new chapter in the Aquatic Code with the relevant orientations in the aquatic manual or another appropriate tool suggested by WOAH. As aquaculture is developing, the absence of such guidance creates regulatory uncertainty, and on the contrary, you would want to have ensured the quality and implications for the trade and the responsible management of antimicrobials for aquatic animals. This question is all the more important if we consider that aquaculture production systems are connected with lakes or water ponds that can be shared across borders, and we therefore would like this to be examined in the working program of the Commission as a priority field of work for future legislatory regulation and legislation work.
Muchas gracias por el comentario.
Thank you for your comments. Yes, it is interesting to be able to move on in a chapter by taking in consideration all elements with regard to safety and efficacy, and this includes these new elements. We're going to submit them during the next September meeting, and in order to be fair, during the last meeting, China also made a proposal to work for us to work on vaccines. So apparently, it is a proposal shared by many countries. Thank you.
So we do take note, and it will be included in the work program of the aquatic manual. So this particular request it should go under the manual. Thank you.
Gracias.
Okay, thank you for the clarification. I see China, please. If you can give the mic. It's Korea. Can you show the placard? It's Korea. Korea. Okay.
Republic of Korea supports this Annex 6 as it is aligned with the WOAH framework and disease prevention. In addition, Korea believes that compulsory following is an important measure for pathogen elimination and preventing reintroduction. In this regard, once Annex 6 is incorporated into the code, Korea would like to suggest that Commission may further consider applicable biosecurity measures during the compulsory following period. We believe this could help reduce the risk of pathogen reintroduction and support the effective implementation of following measures. Thank you.
Thank you, Korea. Back to you, Alicia.
Sí. Thank you for the comment. Only to clarify, you are thinking in a part of a control program to continue with some recommendation about the other measures during the production activities. Okay. Okay, thank you very much. Yes, we are trying to consider, because the terrestrial code has the official control program in the code. So could be a good idea to consider to proposal maybe for the new commission this kind of activity, because Korea is right. We are putting the following period, so now we are in the condition to consider preventive measure during the production site as an official program. Okay. In addition to the general biosecurity measure considering in the section 4. So it's a good idea. So we could discuss in the next.
Okay, so we take good note of that. Any other intervention? Okay, we are in conditions to propose the adoption of this Annex 6. And so, with the amendment already mentioned, I ask if there are any objections. No? Any abstentions? So I confirm the adoption of the Annex 6 by consensus. Yes. I mentioned that with the amendment that we identified previously.
Muchas gracias. Voy a volver al español para explicar esto. El anexo.
I will switch back to Spanish. Annex 7. Specific control of fish diseases. We compared the various articles with regard to biosafety and active surveillance and passive surveillance. This disease had been left aside, and it's important that we use the model that have been used in various countries for them to be declared as free from the disease. We specified for this disease, Chapter 2C, the historical exemption surveillance certification. We need to understand that diseases have different features regarding the way the disease behaves, and also with regard to the hosts. And here there are several hosts, 6 hosts, 5 of which, according to what the reference centers tell us, 5 of which show no symptoms, no clinical signs, even when the environmental conditions are favorable. What is even worse is that the species that will show clinical signs actually includes variants that do not show clinical signs. So we conducted an analysis within the Commission to try and understand what would be the best strategy. Pathway number 2 for this disease, and when pathway number 3 could be activated for active surveillance. So we would move from passive surveillance to active surveillance. And I would like to show you, that's it. No, sorry. I wanted to show you one slide. I've lost one slide.
Ya, no, es que vi que no estaba. Es que era importante, ¿no? Si no está. No, no está. No, perdí la tabla. La tabla, bueno, la tabla 1.1.
I'm sorry, I've lost the slide. It was a table that shows the 4 ways to achieve declaration of a country free of disease. So there's an absence of the species of the disease. Second column, the historical freedom of the disease, and there are 2 options. Either the animals are submitted to passive surveillance, the institutions are informed if there is an increase in mortality or if any clinical signs are observed, as described in item 12 of the surveillance chapter. The passive surveillance could be moved to active surveillance when there is an epidemiology connection and passive surveillance is no longer sufficient. So this is surveillance for pathway number 2. But as soon as we decide to keep the surveillance pattern, I'll explain. If the disease shows no clinical signs, we need to move to pathway 3, which is active surveillance. It is a challenge because we wanted to write all of this in the specific chapter, and we wanted to make sure we understood each other. And so we made a proposal with pathway 2, including the fact that animals are submitted to pathway 2, passive surveillance, will need to comply with what is written in the manual. In the manual, we see all the species, susceptible species, and the species capable of showing clinical signs. And we dared to include a new article 2.2.5. Sorry. The speaker stopped speaking. Okay, yes, I apologize. I was mistaken. Before we move on to the infection with Villatus Francis, this is the Annex 7 in connection with the susceptible species, which have to do with this particular disease and the ad hoc group. And so we have included Astropotamobiobus torrentium as susceptible species, and we have made it available so that you can make comments. Anyone would like to make a comment? Korea?
Starting by Korea.
Thank you, President Garcia and WOAH Aquatic Animal Commission. The Republic of Korea supports the proposal to list Astropotamobius species as susceptible host species for crayfish plague. However, we noted that in the proposed revision of Chapter 2.2.9 of the Aquatic Manual in Annex 18, stone crayfish belonging to Astropotamobius are still described as species with incomplete evidence for susceptibility. Therefore, we would request the Commission's review to ensure consistency between the code and the manual. Thank you.
Okay, let's now hear Finland. We have the floor.
Thank you, Madam Chair. I speak on behalf of the 27 member states of the European Union. The EU in general supports the adoption of this revised article. However, we suggest 3 editorial changes that have also been sent to WOAH ahead of the general session. Firstly, in the first sentence of the article, the words "the following" are not needed and should be deleted. In the table, in the second column, in cases where it states species, the words "all species" in parentheses are not needed and should be deleted. And thirdly, in the table, in the third column, we note that in some cases, N/A, meaning not available, is indicated, while in others it is no common name. We propose that it should consistently state N/A. Thank you.
Thank you, Finland. Any other comments, interventions that you want? No? Back to you, Alicia.
Ok, muchas gracias por los comentarios.
Thank you very much for your comments. We have taken note of the comments made by the European Union representative, and we include them in the article. For Korea, we would also like to thank Korea for the observation shared, because in this chapter, we talk about the susceptible species, but in the manual, there is an article, a specific section referring to incomplete susceptibility species, and there is a mistake. It is right, there is a mistake whereby the species remained in the incomplete susceptibility column, whereas they actually were a complete susceptibility case. So thank you for this observation. For the European Union sake, we are taking into consideration what you are saying. You're right. We have deleted all species, all species, all species in all the lines where it was supposed to be deleted. And for the manual, with regard to the proposal made by Korea, we have looked at our working plan in such a way that the corrections will be made, and this will also be made in Annex 18, towards which your comments were oriented.
Of Annex 7, are there any objections? No. Are there any abstentions? Thailand? Okay, I can't see any others. So we confirm the adoption of Annex 7. Back to you, please. Okay, good idea. Let's have a break now. I hope that I can count with you here in our plenary session in 30 minutes, so it means 4:30. And remember the quorum, the need of we must have quorum in the room, so enjoy the break. Dear colleagues, just to let you know that we are far away from the quorum, so we need to wait for 13 more delegates to be here in the room before starting the meeting. If you can call the colleagues, please, it would be good for all of us that we are here in the plenary. Thank you.
And if I can take advantage, for those that have been making comments, if you want your comments to be well reflected in the report, I invite you to share them with the Secretariat. You can either send it by email or I know some of you have it in paper. Please give it to my Secretariat so that we can have as precise as possible the comments that you're making. So we still have 81 quorum. So if you have any of your delegate friends on your WhatsApp, just send them a message saying, hey, we really need you here. We want to get out of here early, so it would be good if you can come in.
We need 6 more. Please call your colleagues.
we need only 4 more. So if you can please, I don't know if you identify somebody that was here earlier, send them a WhatsApp or something. Yeah, 3 more now. Please be aware that after we finish with the aquatics, we will be discussing the resolution. So it's also very good to have you around so that we're all happy with the resolution for the technical item, which we were all very enthusiastic in the beginning of the week. I know you're all maybe a little bit tired. It's been long sessions, just a little bit.
Yeah, but they are brave.
You're brave. Thank you so much for being here.
Yeah. 2 more.
Yes, now we can.
Okay, perfect. So let's start. Thank you for being here. Now we are 93 delegates in the room. So back to you, Alicia. Can you continue, please?
Thank you very much. I am going to the Annex 8, que les traté de explicar.
I will try to show you the table 1.1 for Article 10.1.4. So this is the surveillance with the 3 procedures to report that this is free for aquatic species. See here, you can see the column with surveillance, primary surveillance and secondary surveillance. So remember that there's also the opportunity as part of procedure number 2 to complete it with active surveillance when there's a popular number of animals that is connected with another groups of animals that may have signs. If that's not the case, then we move on to procedure number 3 in our proposal. We have 2 articles, and historical freedom is still being studied. We have 2A, which is a link which is related to the cross-reference in the manual with Article 2.2.5, which determines the species that show clinical signs. And then we have specified that procedure number 2 may apply to species with clinical signs. If they have no clinical signs, surveillance may not be sensitive enough. That's the article that we'll leave to you, and we leave it to submit it for comments. And then there are some countries that address the basic conditions of biosecurity on the basis. And the reference centers said there was 15.
I open the floor for your interventions. Australia, please.
Thank you, Madam President. Australia speaks on behalf of the Animal Health Quadrilateral Alliance. We do not support adoption of the proposed changes in Annex B on provisions for self-declarations of historical freedom from Gyrodactylus salaris without modifications to the proposed text. First, we feel that references to specific aquatic manual articles could limit member risk assessments in their surveillance design. So we propose removing the reference to Article 2.2.5 in point 2A. The text would therefore read, and taking into account relevant information concerning clinical expression in relevant sections of the aquatic manual. Second, the new final paragraph of point 2B conflicts with Aquatic Code Chapter 1.4. Specifically, Article 1.4.12 clearly provides for the use of targeted surveillance where passive surveillance alone is insufficient, including for populations or strains with limited clinical signs. The proposed paragraph risks undermining established pathways for demonstration of disease freedom, as well as setting a precedent of inconsistency across disease-specific chapters of the Code. Therefore, we propose the following text. Pathway 2, in parentheses, historical freedom, is only applicable to make a self-declaration of freedom from disease for infection with G. salaris if the study population includes strains of susceptible species that exhibit clinical signs. Targeted surveillance can supplement passive surveillance as described in Article 1.4.3 and 1.4.12. The Quads Alliance supports this simpler, more proportionate approach which relies on the existing code framework to guide members' surveillance approaches designed to suit their populations and risk profiles.
Thank you, Australia. Alicia, did you get the chance to hear all the proposed text?
Muchas gracias por las...
Well, thank you very much. It's complicated to explain, and I think that it's a good example that between all of us, we can find the best description for this procedure that is so important. So I took note of all these comments, and after an in-depth analysis, what was suggested for adoption is Annex 8, and we left the orange highlights, although the amendments are highlighted in orange. And the first article, as suggested in Article 2A, we removed Article 2.8.5. So you can see it in orange. This is what we deleted, and we added the cross-reference. In other words, we may use procedure 2 when animals are clinical signs as defined in the manual. In 2B, we included a cross-reference with 1.4.12, so because it's about additional surveillance at 1.4.3, which is the table that is added. These are the amendments that we suggested.
Thank you, Madam Chair. Japan supports the adoption of the article, this article, with the amendment proposed by the President right now in response to the intervention by Australia on behalf of the Quads. Thank you.
Thank you very much, Japan. United States of America, over there, yeah.
Thank you. I speak on behalf of the region of the Americas. The 33 countries of the region of the Americas thank the Aquatic Animal Health and Standards Commission for taking the concerns of members into account and proposing modified wording for inclusion within Articles 10.3.5 and 10.3.6 country and zone freedom for infection with Gerodactylus salaris. This modification supports consistent understanding of country and zone freedom requirements amongst members. Thank you.
Thank you, United States. Any other interventions? No, Alicia, do you want to final comment before proposed?
Muchas gracias por los comentarios.
Thank you very much for these comments. They are very relevant, and they do provide a lot of clarification on the texts.
Standard. So, are there any objections? No. Any abstentions? No. So it's approved. It's by consensus. Confirm the adoption. Back to
Muchas
you.
gracias. Pasamos en
Thank you very much. Now, Annex number 9, and it's to adjust the basic terms for biosecurity and targeted surveillance period. And we have also adjusted it with the comments from the report. So that says there's a period of 2 years for the compartments that are infection-free with regard to infectious salmon anemia virus. So now the comments.
The floor for interventions. I don't see any interventions, so we can go and propose for adoption. Are there any objections? Any objections? Yes. No. Any abstentions? No. So we confirm the adoption by consensus.
Thank you. Este es el último anexo que se refiere con el ajuste de los nombres de las enfermedades virales de acuerdo a el Comité Internacional de Taxonomía de Virus, el ICTB, y es así que hicimos ajustes a los capítulos respectivos de enfermedades de crustáceos, de peces, moluscos, y los sometemos a consideración de la Asamblea.
Gracias. Open the floor for interventions.
We've made some adjustments here. Oh, sorry, I didn't hear. Oh, yeah. Yeah, it's working. Yeah, sorry. Yeah. Yeah. Yes, it's working. Yeah, yeah. Yeah, it's working. Yeah, I'm speaking. I don't know. So we're going to repeat. Yeah. So we will adjust the viral names of the viral will adjust the viral names of diseases according to the International Committee on Taxonomy of Viruses, ICTV. This is how we adjusted the chapters for diseases in crustaceans, fish, mollusks, according to the new viral taxonomy. And now it's open to your comments, all your relevant comments.
Requesting from Chile and Estonia. Start from Chile.
Thank you very much, Mrs. Chair, Madam Chair. Chile would like to thank the work of the Commission, of the ad hoc groups to prepare the amendments that we are about to analyze, and also more specifically Annex 10 and Chapter 10.4.1 as infectious salmon anemia, some with 2 genetics. We remove HPR, or without removing HPR 0. As you can see, we are deleting the words non-pathogenic. Chile is asking for the re-inclusion of this term after the description of HPR 0, because it's very important so that you fully understand the differences with the other strains, and also it's important in order to prevent the impact on international trade. We're asking to include this change before this annex is submitted to the vote.
I speak on behalf of 27 member states of the European Union. The EU in general supports the adoption of revised articles. However, we suggest an editorial change. Indeed, in Chapter 9.3, the word infectious needs to be added before the words iridescent virus 1 to be in line with the changes proposed in the title of a Chapter 2.2.3 of a manual in Annex 22. Thank you again.
Thank you, Estonia.
Yes.
To Norway, over there, back in the back, yeah.
Thank you. Just want to highlight that we support comments from Chile and that the same goes for the Annex 22 with non-pathogenic. Thank you.
Thank you, Norway. Well noted. Any other intervention? Oh, back to you, Alicia.
Thank you very much for the comments. Now we changed the goal. I mean, we wanted to change the viral name, but there are diseases like the infectious virus. You know, there was a change in the text. It was like this 10 years ago, and the comments by Norway and Chile are, of course, very relevant because countries are used to this specific nomenclature in the articles, and I think we can maintain the chapters as they are. We'll only update the names pursuant to the suggestions of the taxonomy committee. That is why we made some comments. So I suggest we get back to the original version that said virus, ISAF virus, and the pathogenic agent, HPR0, without without deletion of pathogenic. So this is how it was originally. And I'd like to thank you for your comments on chapter 9.3 for BIV1. And everything that we've done, I mean, for the names of the viral infections, it's infection by infectious BIVY. And we suggest that we may adjust it to be fully in line with the manual and with what is stated in the code. But we don't think it's relevant to change the acronym. As for like for virus ISAF, because ISAF virus, you know, the countries are used to having acronyms, BIV1. So we will maintain this acronym for this specific chapter 9.3.
First, want to ask if you have any comment for this on this clarification. No, so we propose for adoption this standard, and I ask if there are any objections with these amendments, of course. Any abstentions? So I confirm the adoption of the standard by consensus. We can move forward.
Muchas gracias, Presidenta.
Thank you very much, Mrs. Chair. Now, Madam Chair, so now we're going to proceed with the texts that are submitted for adoption. So beforehand, I'd like to explain that we have 5 annexes. One is about the update of the species in the species. Then we're about to adapt the chapter on mollusks. And I'm very happy to work on this point, especially after I saw Jenny's presentation yesterday. You know, there were several epidemics, pandemics in mollusks. So we're adapting the main chapters of the manual. So we're suggesting chapter 2.4.5, infection with Perkinsus marinus, 2.4.6, infection with Perkinsus olseni, and chapter 2.4.7.7, infection with Xenohaliotis californiensis. And then we also reviewed the names of the viruses. And I'd like to say something before I review every chapter. Given all the comments that we've received with regard to the case definition for all chapters, we've decided as Commission that it is necessary to have additional analysis. So consequently, Madam Chair, we suggest that we may leave the 3 chapters with section 6.1, 6.2 under study, because as noted in the terrestrial code, this is a key aspect in order to make decisions, especially when it's the first detection of the disease. And I think that now we should adapt all chapters on mollusks on the basis of the significance, and we should have a more exhaustive review during our next meeting in September 2026. This is what I wanted to say before we move on to the next chapter. First of all, we have Annex 18. It's about adaptation or revision of susceptible species and in line with the recommendations of the ad hoc group and Article 1.5.9. And here, I would like to pick up with what Korean and Canadian representatives said. We will review the species and we will correct the amends section that refers to incomplete evidence for susceptibility, because it's no longer part of this group. It's in the group of susceptible species. So there'll be a review of the code in the manual. So for susceptible species, and we would delete the agent from the non-complete susceptibility section. Now the Assembly may make
no interventions, so we can.
Cyprus.
We have? Okay, over there, yes. Cyprus.
Thank you, Madam Chair. I speak on behalf of the 27 member states of the European Union. The EU in general supports the adoption of this revised article. However, we suggest 3 editorial changes that have also been sent to OAH ahead of the general session. First, the first sentence of the article, the words "the following" are not needed and should be deleted. In the second, in the table in the second column, in cases where it states SPP, the words "all species" in parentheses are not needed and should be deleted. And 3, in the table, in the third column, we note that in some cases, "not applicable" is indicated, while in others it is no common name. We propose that it should consistently state "not applicable." Thank you.
Thank you so much, Cyprus. Any other comment or intervention? No? Back to you.
Muchas gracias por el comentario.
Thank you very much for the comment. And indeed, we have received all your comments and we made all the adjustments in line with the editorial revisions that were proposed.
Changes that Alicia already mentioned. So, there are any objections? No. Any abstentions? Thailand, over there, an abstention. Okay, standard. I confirm the adoption. Thank you.
Thank you. Pasamos al anexo.
So let's move on to the Annex 19. This chapter on infection with Perkinsus marinus. So here we have updated the information according to a reference laboratory and expert laboratory. We completed table 4.1 that sets out all the diagnoses that are recommended for apparently healthy animals and the confirmation of their healthy status. And as what I said earlier on, we decided to make a proposal for a case definition, but then we decided that given the comments that we have received, we will put the definition of the case under study in this specific chapter.
Entonces, después de recibir
So after receiving all the comments for this specific chapter, we've also received comments about section 2.4.5, the species with incomplete sustainability, so that we can adapt the scientific name of Castrostria gazar to Crassostria tulipa. This is in line with the scientific evidence. I'd like to thank you for your comments, because there was a review and we've made some changes in section 3.2.2 with regard to selection of organs or tissue. It has to be replaced or with and. It was as suggested by a member state, and we would add tissue samples that are necessary to perform a diagnosis. And as previously said, we'll leave the definition of suspicious cases under study for apparently healthy animals and clinically affected animals, and the definition of a specific case for apparently healthy animals or clinically affected animals for in section 6.2 and 6.6.1.
Vamos para
So who wants to?
The floor for interventions. Korea and Denmark. First Korea.
Thank you, Chair and President Alicia, and also WOAH Aquatic Animal Commission. We are appreciated to giving us the opportunity to take the floor. The Republic of Korea supports this proposed Annex 19 regarding infection with Parkinson's marinus, which present validated diagnostic method and revised direction for complementary diagnostic criteria. We also look forward to continue the collaboration and research between WOAH and member country so that more rapid and accurate diagnostic method can be developed and applied for other aquatic animal diseases in the future. Thank you.
Thank you, Korea. And now Denmark.
Thank you very much. And I speak on behalf of the 27 member states of the European Union. And in general, we support the adoption of this revised article, and we also commend you for taking on board, I think, all the comments that we sent you in advance. And just to be sure, for the sake of consistency in the manual, we would propose an alignment of the definitions of confirmed case in apparently healthy animals and of confirmed case in clinically affected animals across all mollusks chapters. And as I see some comments that we also sent on section 3.2, 6.1.2 and 6.2.2 ahead of the general session has been implemented. So thank you very much for that.
Thank you, Denmark. Alicia, please.
Alicia. Mrs. President, Madam President, I suggest that we review the 2 chapters on the Parkinson's, and then we'll move on to another point. So now, let's move on to the Parkinson's Olseni chapter, Annex 20. Here we have proceeded in the same manner as for the previous chapter. Table 4.1, scientific harmonization and pending definition for some cases. We've received some very good comments with regard to sample tissues in the diagnosis, tissue samples in the diagnosis process, and case studies for 5.1 and 5 and 6.2, 5.1 and 6.2. So as a result, we'd like to have the 2 chapters combined under a whole package.
To hear from you, if it's clear. No comments, no interventions, so we can proceed. And so we propose for adoption first Annex 19. So I asked if there are any objections. Okay, no, there aren't. And abstentions? Okay, I confirm the adoption by consensus. And now Annex 20. Are there any objections? No. Any abstentions? No, so I confirm both adoptions by consensus. Can proceed.
Pasamos.
So thank you very much. Now we're going to proceed with the third mollusk disease infection with Xenohaliotis californiensis. So we analyzed the susceptible species. We completed table 4.1, and we are suggesting that we may leave definition of 6.1 and 6.2 under study for apparently healthy animals or clinically affected animals. And now we move on to the session for comments.
Cyprus. Okay, please, micro over there. Thank you.
Thank you, Madam Chair. I speak on behalf of the 27 member states of the EU. The EU in general supports the adoption of this revised article. However, for the sake of consistency in the manual, the EU proposes an alignment of the definitions of confirmed case in apparently healthy animals and of confirmed case in clinically affected animals across all mollusks chapters. Some comments on sections 6.1.2 and 6.2.2 have been sent to OAH ahead of the general session. Thank you.
Thank you, Cyprus. Any other comments? No? Back to you, Alicia.
Okay, thank you for your comments. I agree with you.
Any objections? No. Any abstentions? So confirm the adoption for consensus. And the last one.
El último anexo del manual es ajustar.
Last annex for the manual. We're talking about a revised scientific list of names for the viral pathogenic agents of WOAH listed diseases. We have added what was approved in the code. We added infectious before the decapod iridescent virus 1 name. So it's now infectious DIV1, which is in line with the code. We also made a few editorial adjustments based on the comments that you sent us. We will move to the comments.
In Norway.
Gracias, Presidenta. Solo mencionar que...
Thank you, Madam Chairperson. I simply, in this Annex 22, chapters 234 in the aquatic manual, we ask to include the name non-pathogenic for the virus. I thought I had seen that it was written, but it was not spoken, so I just wanted to confirm it was there.
Thank the Aquatic Commission for its diligent work and ongoing commitment. We appreciate the careful consideration given to members' comments, which we believe that strengthens both the scientific quality and trade applicability of the Aquatic Code and the Aquatic Manual. Thank you.
Thank you, Norway. And now let's hear Cyprus.
Yeah, I speak on behalf of the 27 members of the European Union. The EU in general supports the adoption of these revised articles. However, we suggest an editorial change. Indeed, in chapter 2.2.3 in section 1, scope, the word infectious needs to be added before the word decapod iridescent virus 1. to be in line with the changes proposed in the title of the chapter.
Thank you, Cyprus. Alicia?
Sí, gracias por la acotación. Efectivamente son en
Thank you for the suggestions. There is the title and there is the scope. So yes, we have added it.
I ask if there are any objections. No. Any abstentions? No. Standard is adopted by consensus.
Señora Presidenta, me permito.
Madam Chairperson, I would like to take the opportunity to thank Savalenan, who was served as our contact person during the whole work for the manual. I worked with her. She's going to retire soon, so I wanted to wish her farewell on behalf of the Aquatic Animal Manual. Thank you very much for your help. Great. Now we have to move on and talk about the reference center network. This is very important information, especially for aquatic animal commissions. We need centers to support us with the scientific information. So this is a presentation on the centers per region. We have 6 collaborating centers for aquatic animals. We have reference laboratories also, very specific ones, and 63 for aquatic animals. We also have a network between the 6 collaborating centers, and this is very helpful because it provides a general vision of some diseases and it gives us a good vision of some epidemiology situations. So we're very happy that we can rely on this support, and we really would like them for their support and their participation. These are the figures that I mentioned earlier. We have collaborating centers for terrestrial animals and aquatic animals, and we have 27 diseases through 39 reference laboratories for aquatic animals. Over the years, twinnings and partnerships were organized between the laboratories. There was a very positive evolution, and now we see the impact that the reference laboratories are having on aquatic animals. And with regard to collaborating centers, I am very happy to announce that we have 6 collaborating centers now helping us with regard to antimicrobial resistance, emerging diseases, and so on. This was voted on. We organized an electronic vote. Madam Chairperson, you can confirm. We now have a draft resolution for a new reference laboratory submitted to the Assembly. This is the location of the new reference laboratory. It is a Norwegian veterinary institute. The designated expert is David A. Strand. There was a vote. Thank you very much. Thank you again. You have no idea how pleased we are to have so many laboratories.
It's very important to have this new reference laboratory.
Sí, exacto. Bueno, y finalmente quería conversarles.
And to finish, I'd like to talk about the work program because we have been working on this work program throughout the year. We performed 32 items or tasks, priorities 1 and 2, 6 annexes included in the code, and 5 annexes included in the aquatic manual. And we also circulated 12 annexes, which were circulated for comments. We would like to thank all the countries who sent comments, Australia, Brazil, Canada, China, New Caledonia, European Union, because thanks to their comments, we were able to strengthen our working program. So what we would like to do, as I said earlier, is work with the Terrestrial Animal Commission online so that we can make progress with regard to horizontal subjects, transversal subjects. What kind of work are we working on? Chapter 1.1, notification of diseases. We are currently revising, assessing the emerging diseases. And we also analyzed the compartmentalization chapter, for which we received at least 100 comments during the previous meeting. We have performed an in-depth analysis of all the comments. We have included most of the comments, and we are therefore asking you now to revise the review the chapters. And the member countries suggested that we added the definition of dependent compartments. It's to separate it from independent compartments. All of this should be consistent with the 1.4 article on surveillance. So we added the article so that we could vote on it. We also included the zoning application, and we believe that the September meeting will allow us to introduce our new position. We also have been working on Section 5, so as to be aligned with the trade-related chapters. We made the Chapter 6.2 revision available for you regarding antimicrobials in order to be aligned with the terrestrial code. Now, it took some time, I'll grant you that, but we were very active and we have been taking in consideration many comments. We started from 6.10 and we then adjusted it to the language and the terminology that we normally use. We also asked for your opinion on Section 7 regarding welfare. There are 4 chapters regarding welfare. And we asked the members the following question: what scope did the countries want to give to these changes after having asked for an expert opinion? If those changes are very specific or whether they are more general. And we wanted to hear your opinion before we started working on each chapter. May I remind you that we have worked on transport, animal welfare during transportation, during ritual killing, and for the introductory chapter. Madam Chairperson, due to climate change and all the issues that we have been discussing over the last 4 days, we would like to say that at every meeting, we see new diseases emerging, and one of our members made a very exhaustive report, and we reviewed the report. So I think there is one country, I think it's China. One country suggested that we adopt a systematic mechanism through a collaborating center so that we can have the information before the meeting, and the meeting can be used in a more efficient way to be able to analyze the information. We don't waste time and add work. It's better if we have a permanent system available for all the commissions so that we can have a look at all the emerging diseases as they emerge. And we're very happy to see what happened recently with this disease that can be considered as a zoonosis, with the Quadripartite Alliance and other laboratories that helped us activate our internal procedure within our organization. We're going to work on in such a way that we will be aligning the articles when we suggest the compartmentalizing chapter. In the manual, the initial proposal was to continue working with the new format for the chapters, and we would like to make progress with the chapter dedicated to amphibians. We would like to call for applications from experts who specialize in amphibians. It's very difficult to find people who specialize in amphibians, so please support us, please help us. Take the opportunity to ask for your help. And we're going to update the susceptible species chapter with the chapter 1.7. And since you already have adopted the chapters on mollusks, we will include in our work program the analysis on case definitions for 6.1 and 6.2. These are the annexes that I am submitting to your attention, and the 4 annexes for the manual. We are currently including 2 chapters regarding the infection with Bonamia exitiosa, which makes sense because last year you also discussed the case definition, and we are currently performing a review. So we would like to submit to your comments these issues so that we can improve with your comments. And regarding mollusks, we're also following the infection with Martalia refingens. This chapter has been, you have been waiting for a long time. It was difficult to make progress. There we seem to accumulate delay. We did not get much help from the reference laboratories, not because they did not want to work, but simply because they were up to their armpits in work. But now we have a chapter, an exhaustive chapter, which is ready for the manual, and we would like you to send us your comments. This is an important condition in all the regions. We have also changed the PCR tables for the infection with the spring viremia of carp virus, and we are counting on the collaboration of some reference laboratories. We are also asking for your active collaboration. You could send us comments before July the 3rd. Please write to us at the Secretariat email address. We are looking forward to receiving your comments. Your comments are always very helpful, and they fuel our discussions, and the chapters become much clearer and are easier to adopt by member states if we have received the comments.
To thank you because we could see your engagement and committed with all these chapters and all the standards that you propose and bring here to the Assembly. It's very good, and of course I also thank the team that are with you and you are sharing. Thank you so much. And I also want to thank the Assembly because they gave us very good comments that you could embrace all of them, and I think we may conclude that we had a good common effort to have all these standards approved today. So thank you again, Alicia.
Gracias. Muchas gracias.
Give the floor to Dr. Emmanuel.
Yes, thank you very much. I just wanted to make a comment at the step of the day. I think we have seen all day long how science is really at the heart of our organization. And I really wanted to take this opportunity to really sincerely acknowledge the work of your experts, because it is experts of the members. So we have seen the experts of the Terrestrial Animal Health Standard Commission, the experts of the Scientific Commission for Animal Disease, Aquatic Animal Health Standard Commissions, and we will see tomorrow the work of the experts of the Biological Standard Commission. I also want to thank the President, because President is not always an easy role, I imagine, but beyond, I also want to thank all the experts of the working group, and we saw this morning AMR working group and wildlife working group. You have seen how many ad hoc groups we have, so also a lot of expertise, and finally all experts of WOAH reference centers, reference laboratories, and collaborating centers. In all, I don't know how many experts, around maybe 800 or something like that. That's what we say in our website. But it's a lot, and it is really, I think, a great system. And so for all experts, I think we can make a round of applause.
Okay, Ecuador. Happy to give you the floor.
Gracias por permitirnos expresar.
Thank you for giving us the opportunity to take the floor. Ecuador would like to thank the Commission for having reviewed the code and for having strengthened the sanitary measures. We would like to well, we consider that the list does not contain all the criteria with all the reportable diseases and all the changes in public health for agricultural production or forest reproduction. And since we don't have a definition, we would like you to reconsider and remove HMV from the list of reportable diseases. Thank you very much. It isn't quite clear. We have not really grasped with the experts the difference between the endogenous viruses and the other viruses, the host viruses. There is no method here to make the difference. So that's why we really need to talk with the reference laboratories, and we're going to organize a meeting with them. And Ecuador has forwarded written comments, so we received them. But to be able to list the disease, we need to receive the history so that the information has all the available information. Thank you very much for these comments.
Thank you so much, Alicia. Yes, please, if you want.
Yo quisiera dar las gracias a todos los puntos.
I would like to thank all the focal points, aquatic focal points. They're not all present here today in the room, but we're a family. We are highly specialized. And I really would like to thank all the colleagues in the Commission for their efforts. I would also like to thank the Secretariat. My father passed not very long ago. He was a soccer player, and he used to say that to win a match, you had to work as a team, have a peripheral vision, and know how to pass the ball to someone else in order to score a goal. And I must say that what we are doing is precisely that. We are working as a team. And we believe that success for us will consist in preventing diseases affecting aquatic animals. Thank you very much to the whole organization.
It's really a good way to finish this session. Thank you so much, Alicia. And now we must proceed. We have another important part on our agenda in this afternoon, and we will now start to discuss the technical item resolution. And for that, I invite Emily Tagliaro to present resolution number 35, Investing in Animal Health to Secure Everyone's Future. Emily, happy that you join us, and I give you the floor.
Good afternoon, everyone. We're almost at the end of the day. So I hope you've had a chance to look at the resolution that's on the website. In any case, distinguished delegates, dear members, I have the honour to present the draft technical resolution for discussion by the World Assembly. A draft version of this resolution was developed considering the interviews conducted to develop the technical item and integrating the valuable insights provided by the Council last week. The draft was made available to all members on the WOAH website since Tuesday, allowing you all to review the proposed orientations in advance. Following the technical item, as well as the very rich panel discussions and the questions raised during the forum, the drafting committee, composed of members representing all 5 WOAH regions, met to finalise the text on Wednesday morning, which is presented to you today. I would like to take this opportunity, firstly, to thank all the members and the partners, and our rapporteur, Dr. Frank Bert, sitting in front row, for their essential contributions to the technical item, for their active participation in the panels, and for the many thoughtful questions and interventions during the sessions. I would also like to express a special appreciation to Australia, Denmark, France, Kenya, New Zealand and Oman, not only for their valuable participation in the interviews, in the panel discussions, but also for participating in the resolution drafting committee yesterday morning. The revised draft resolution was uploaded on the website today. This is obviously a topic of growing importance for all the members. There really is a need to invest in animal health to secure everyone's future. And I think all the panels and the technical item rapporteur really hounded in on that message. So with your permission, I will not go through the considerations, but I propose to briefly summarize them before going to the resolutions point by point. So resolution number 35, investing in animal health to secure everyone's future. Firstly, the resolution recognises that animal health is fundamental to food security, public health, environmental sustainability and economic development, as well as global health security. And all the panels that took place, either the high-level panels, but also the other panels with the technical experts and the delegates, really confirmed this message. It furthermore acknowledged that animal diseases, zoonoses and antimicrobial resistance continue to generate significant economic and social impacts in all WOAH members, while global threats are increasing. The resolution further recognises that many animal health systems remain underfunded, despite their strategic importance, and that more sustainable and innovative investment approaches are needed. It also really took the opportunity to highlight the important role of the private sector across the whole value chain in supporting service delivery, innovation and investment. It further recognises the strong willingness of private actors to invest and complement the efforts of national veterinary authorities, provided that clear governance, transparent regulatory frameworks, mutual respect, as well as enabling business conditions are in place. Finally, the resolution recognises WOAH's central role, while recalling the commitments made by all UN member states at the 2024 United Nations Political Declaration on Antimicrobial Resistance, as well as the outcomes of this forum, which confirm the need for structured and sustainable financing approaches to strengthen veterinary services globally. Before proceeding to the recommendations, I would like to invite any comments from the members on the considerations contained in the draft resolution. I would also like you to make sure that any proposals for amendments are supported by a clear proposal on the requested modifications to the text. Thank you.
Thank you, Emily. I would like to remind delegates that the draft resolution will be presented for adoption tomorrow, and I'm happy to open the floor to hear your interventions about the proposal, the draft that Emily is showing us today. Any clarifications? Any intervention that you want? Until now, nothing.
Okay.
You can proceed.
Thank you very much. So I'd like to present to you Resolution 35, the recommendations. The Assembly recommends that 1. WOAH and its members intensify high-level advocacy to position animal health as a strategic investment priority and to promote the necessary and sustainable financing at national, regional and international levels. 2. Members sustainably invest in animal health systems to support equitable access to essential veterinary services and to build robust animal health workforce, supported by the necessary infrastructure, including digital and data management. These systems should enable the application of appropriate management practices to support animal health outcomes and promote the timely supply and responsible use of quality and affordable essential veterinary medicines, vaccines and diagnostics. 3. As highlighted in the technical item, members apply a cascade approach to financing animal health, which includes optimizing the use of private sector solutions where viable, addressing market and regulatory barriers, and strategically reserving public resources for core public goods, recognizing their essential role in national, regional, and global health security. WOAH and its members recognise that transboundary animal diseases, zoonoses, and antimicrobial resistance are global public good challenges that require international collaboration and increased and sustainable financing, including grants and concessional resources, and commit to engaging with investors, international financing institutions, and development partners, while urging them to help curb their impact. 5. WOAH and its members convene regular dialogue among public and private stakeholders to facilitate coordination, knowledge sharing, and exchange of best practices on animal health financing, including public-private partnerships and innovative approaches without prescribing specific models. 6. WOAH and its members develop relationships and engage in dialogue with agricultural technology companies, also called AgTechs, and the broader private sector to identify shared objectives and foster mutual understanding and encourage the sharing of relevant data with veterinary authorities. Number 7. WOAH and its members meaningfully involve the private sector in the development and alignment of international standards and guidelines to ensure that they are outcome and science-based, while also taking into account the practical and operational considerations of industry implementation across the value chain. Number 8. WOAH works with partners to support WOAH members by developing, identifying, sharing, and training on practical tools, guidance, and analyses to build the capacities of national veterinary authorities to plan, regulate, and interact within a multi-actor animal health system. The key partners include, among others, the World Bank Group, the International Fund for Agricultural Development, the Organization for Economic Cooperation and Development, the Food and Agriculture Organization of the United Nations, the United Nations Environment Programme, the World Health Organization, as well as WOAH reference centres. Number 9. WOAH, with the support of the reference network and relevant partners, work in partnership with members to support evidence-based decision-making, enabling members to assess tools to support the cost-effectiveness of different disease prevention, control, and investment options, and by providing replicable and comparable methodologies to quantify the burden and economic cost of animal diseases, as well as return on investment in veterinary authorities and animal health systems. Number 10. WOAH further develop and strengthen its network of collaborating centres on animal health economics, with a view of establishing regional expertise and support capacity in each region to assist members in economic analysis, investment prioritisation, cost-effectiveness assessment, and evidence-based decision-making. 11. WOAH review and evolve the standards, guidelines, and tools related to the performance and capacity of veterinary services, including the WOAH competency and curricular guidelines for graduating veterinarians, the Day 1 graduates, and veterinary paraprofessionals, and the competencies for continuing education, to integrate competencies such as financial literacy, digitalisation and data management, advocacy, and other relevant skills linked to robust animal health systems, while supporting members in strengthening veterinary governance and establishing veterinary statutory bodies. And the last, number 12. WOAH supports its members in strengthening digital and data systems for resilient animal health systems and their integration with relevant regional and global systems by providing guidance and tools to strengthen their capacity. Such systems should enhance disease surveillance, early detection, traceability, targeted prevention and response, foresight, evidence-based decision-making, and investment confidence. Dear President, thank you very much.
Thank you, Emily. So I open the floor again. If you have interventions now, more concise ones. Iceland, Germany. We start from Iceland.
And thank you for excellent presentation of this. I think this text could be benefiting from adding on point 2, on the Assembly recommends that. And if I start to read the sentence, these systems should enable the application of appropriate management practices to support animal health, and here is my addition, and welfare outcomes. Because I think welfare is lacking. Thank you.
Yes, please, Emily.
Thank you very much, Iceland, for your proposal. We would support that addition. It was just to clarify that, in fact, as part of the consultations for the technical item, it became quite complex, in fact, in the conversations with the membership to separate health and welfare, and so we addressed it as a whole, but we would be very pleased to include welfare here. Thank you very much.
Thank you. We have also a request from Germany. Here.
Yes, thank you very much. It's just a suggestion in the same line as Iceland. I wonder whether it would be possible to insert a reference to animal welfare under the recommendations at some suitable point of the text, maybe in number 4.
Are they global public good challenges?
You should add animal welfare.
Is it a global public good challenge? Sorry, Germany, are you proposing to include animal welfare as a global public good challenge in recommendation 4?
Could you share, please, the resolution on the screen again?
I think where it's named WOAH and its members recognize that transboundary animal diseases, zoonoses, animal welfare, and AMR are global public good challenges.
If there's no objection from the other members, we would be happy to include it.
So it would be. Can you repeat again? AMR.
I think it's animal diseases, animal welfare, zoonoses, and AMR.
And everybody agrees? I guess it's okay. Thank you, Germany. Any other comment or suggestion? Nigeria?
Thank you very much. I think this is very, very commendable. Mine is just by way of the second resolution. Maybe please, if you can go to the second resolution. It's not a serious modification, but resolution number 2, I propose. Yeah, number 2. Yes, number 2.
The considering or the recommendation?
No, the recommendation itself.
Can the regie go down, please?
The recommendation itself. Recommendations. 2.
Yes, 2.
Yes.
Remember sustainably?
Yes, so I want to propose that we talk about is supported by necessary infrastructure. I propose that before including digital and data management, I propose the issue of innovations. Then secondly, mine is just it's an observation. I think the whole of the recommendations, except I didn't follow very well, the issue of aligning our standard with the issue of facilitation of trade in animals and animal products, including certification. I thought maybe we should have something that will capture the essence of this, because beyond the public health and others, the critical role of some of these recommendations with regards to international trade in livestock and livestock products, I think is important. Thank you very much.
Thank you, Nigeria. I don't know if you get it, everything.
Yeah, I might come back to speak to you, Nigeria. I just wanted to highlight that, in fact, the recommendation 2 is a bit of an expansion of the recommendation that was adopted through the political declaration. In fact, the UN member states in September 2024 had adopted a resolution that had been very similar, but we integrated into this resolution the specific elements that had emerged from the technical item. If I'm correct in understanding, Nigeria, what you would like to propose is innovations in a broad sense or innovation in linked to digital and data management?
Both ways. Both ways.
Both.
And the second one?
Okay, we take note, and then Emily will speak with Nigeria afterwards. Okay, any other intervention? Japan? What?
I mentioned the issue of having some recommendations on international trade, linkage of these recommendations with trade facilitation for livestock and livestock products, and the guidelines on certification. I think it's a very key recommendation that should be brought out clearly.
That's why I guess that Emily is going to speak with you to understand better. But I took the point, yes. Thank you. Japan, please.
Thank you, Madam Chair. I just seek clarification from Emily about the recommendation number 11.
11?
Yes, relating to the integration of competencies other than the veterinary related ones, like financial literacy, digitalization, and data management. Is that really meaning that the graduates need to have a diploma or relevant skills other than the veterinary science?
Thanks very much, Dr. Okita in Japan, for your question. What really emerged in the conversations with the delegates that we interviewed across the 5 geographies was that often there was significant challenges for the delegates in negotiating with their line ministries or in understanding economic analyses that were being conducted to support their work. So we're not proposing that they have specific diplomas in, but there could be components of their course that could include these dimensions. It would be up to the ad hoc group who's reviewing the guidelines and competencies to reflect on this recommendation and see how they could best integrate it, considering the curricula as a whole and the capacities of the veterinary education establishments.
And if I can add, in this number 11, of course, there is this day one competency issues, but also continuing education. So it's true that we cannot give to a young vet all the capacities, but we can also provide some continuing education lessons, modules, or that can be useful for people working in veterinary services or in general.
Thank you. That was clear for you, Japan? Yes? Okay, thank you. Any other intervention? No? I guess now people will read it and we can look at it again tomorrow. Don't forget that we will put it for your appreciation and to adopt it. Of course, it's an important document for all of us, considering the discussions that we had on Monday, on Tuesday. Yes? You want to add anything? No? So I guess that we conclude now the agenda. Okay. Go ahead, Emmanuel.
I forgot, but I have to say something to you. I want to ask you, for all members who made an intervention, to provide it written to the rapporteur's table for the part we have this today on the standards, and also I have to recall you that please do not forget to leave your headphones at the exit. And then see you tomorrow.
Thank you, Emmanuel. This concludes today's plenary session. I would like sincerely thank delegates, chairs of the specialist commissions, working groups, experts, and the Secretariat for the contributions throughout the whole day. And of course to you, delegates that were here. We still have quorum at this hour of the day, so thank you. And tomorrow the session will begin at 9. Don't forget to be here on time, and enjoy Paris also. Thank you.